Jomo Kenyatta University of Agriculture and Technology is guided by a clear vision as a university of global excellence in training, research, innovation, and entrepreneurship for development.
The university has a diversity of academic programs, research and innovation enterprise. JKUAT has 5 colleges offering over 400 academic programs.
The colleges are engineering and technology,
pure and applied sciences,
health sciences, agriculture and natural sciences,
and human resource development.
Since its inception, JKUAT has been at the forefront in fostering a culture of research and innovation.
The university's modern teaching and research infrastructure has development of local and international students, faculty, University Institute for Basic Sciences, Technology and Innovation, a graduate hub that has JKUAT at the center of Africa's integration, development, training and research. The establishment of centers of excellence through its extensive collaborations and partnerships with academia and industry has been instrumental in supporting incubation of research into viable commercial ventures that are beneficial to society. Due to this, more top-notch research enterprises at JKUAT and the university are much needed for stage not only in Kenya but in sub-Saharan Africa. JKUAT is, for example, home to the Legume Center of Excellence for Cultural Security, Cassava Research Lab, EU-funded multiplication lab, and Innovation Prototyping Center, among others. JKUAT is also host to the China-funded Sino-Africa Research Center, which has been at the forefront in advancing biodiversity and conservation content. In addition, JKUAT is home to Africa's International Maritime Technology Innovation Center, fronted by International Maritime Organization, to champion research in the emerging economy. With an enrollment of over 35,000 students, JKUAT is currently positioned as Africa's leading university.
Today we utilize it a lot and it's going to be into play. I'm sure the lecturer of entrepreneurship is going to be proud of you because of how
Kenyatta University of Agriculture and Technology is guided by a university of excellence in training, research, innovation, and entrepreneurship. The university has advanced programs, research and innovation enterprise. JKUAT has 5 colleges offering over 100 programs. The colleges are Engineering and Technology, Pure and Applied Sciences, Health Sciences, Agriculture, Natural Sciences.
If you have any members of the school, any members of the units that are not yet arrived, please make the appropriate
JKUAT has been at the forefront in fostering the culture of research and innovation among faculty and students. The university's modern teaching and research infrastructure, as well as a blend of local and internationally sourced innovative students and qualified faculty, gives JKUAT an edge in facilitating the attainment of Africa's
of medical solutions. Besides, JKUAT is proactive in Africa's development, mainly through various research initiatives. In 2012, for example, JKUAT won a competitive bid to host the Pan-African University Institute for Sciences, Technology and Innovation, a graduate hub that has thrust JKUAT to the center of Africa's integration and development through graduate training and research. The establishment of various centers of excellence through its extensive collaborations and partnerships with government, academia and industry has been instrumental in supporting incubation of research into viable commercial ventures that are beneficial to society. Due to this, more top-notch research enterprises at JKUAT have earned the university a much-needed prestige not only in Kenya but in sub-Saharan Africa. JKUAT is, for example, home to the Legume Center of Excellence for Food Nutrition Security, Cassava Virology Lab, EU-funded Food Fortification Lab, and Innovation Prototyping Center, among others. JKUAT is also host to the China-funded Sino-Africa Joint Research Center, which has been at the forefront in advancing biodiversity research and conservation in the continent. In addition, JKUAT is home to Africa's only International Maritime Technology Cooperation Center, founded by International Maritime Organization to champion research in the emerging economy. With a capacity of over 85,000 students, JKUAT is currently positioned as Africa's leading university. Jomo Kenyatta University of Agriculture and Technology is guided by a clear vision as a university of excellence, training, research, innovation, and development. The university has a diversity of academic and innovation enterprise. JKUAT has 5 colleges offering over 400 academic programs. The colleges are Engineering and Technology, Pure and Applied Sciences, Health Sciences,
Ladies and gentlemen, good morning. Good morning again. Good morning. So this morning I'm very delighted to welcome you all to the Jomo Kenyatta University Medical Laboratory Science Student Association. We welcome you to the 2024 National Symposium. Many of you I know they have traveled from far, all the way from very some of us. So to be here with us today, just to mark the day. So as a JKUAT fraternity, we are very privileged to have you here today. So this is a program where we want to bring students from different universities, different colleges. These are medical laboratory students so that they can be able to showcase their skills, their knowledge in different thematic areas. We all have 6 thematic areas in medical sciences. So our big objective is to bring and to strengthen and transform laboratory approaches. We also want to enhance our expertise in medicine delivery. We want to promote student engagement, career development. We also want to do some networking. And we also want to embrace innovation and research. We all know that Jomo Kenyatta is a university of innovation and research, so that is very, very key for us. So we also want to make sure that we want to engage our students in policy formulation, help the Ministry of Health when they are doing policy formulation. And finally, we also want to do knowledge dissemination. Okay? So we have a number of activities that we have organized for you today. We have a medical panel discussing different challenges in health. We also have a symposium, very, very key. So we have participation from different universities. where they will be discussing and showcasing their skills and knowledge in different areas of trade. We also have a career mentorship program. We also have our partners here. We have one of our main partners here. So they will be giving us enlightenment not only to be able to work in hospitals or research centers, we can also have entrepreneurs. So today, I want to take this opportunity again to introduce our guests that we have today. So kindly, I will ask our guests, starting from our senior most, Dr. Kenneth Ibuna. Just say hi to the crowd. He's an immunologist from Moranga University. Welcome Dr. Peter Karanja. He's from JKUAT University. He's a pathologist, microbiologist by profession. We also want to welcome Peterson Maindi, one of our lecturers in JKUAT University. We also want to welcome Mary from We also want to welcome Mr. Stephen Wambua. So we also have Mr. Kamau from Moranga University. We also have Yudia Kemei, Madam Yudia Kemei from the JKUAT University. So we also have a lady here. I'm so sorry I have forgotten your name. Just give me your name, please. Mr. Bear, all the way from China. We also have Mr. Ismail, also from Wonderful Company. So I guess it's our guest for today. So, and we also have our students, University students. Technical University of Kenya, Moranga University. You know what Moranga University? Kenyatta University. KMLTTB University. So I want to all the very best, a very successful day today as we engage in different fields, in different areas. So we are just about to start. So I want to wish you a very fruitful day today, and thank you, and may God bless you.
Some energy for her, some energy for her, some energy for her, kidogo hapo mwisho achome, sio? But you forgive her. Hana ubaya, sawa? By the way, hana ubaya. Ni wenye kupanga event si rahisi. Unajua hivyo? Hana ubaya. Our mom is just amazing and personal. Tutaendelea baadaye. So allow me to invite you to officially to give a prayer, then we shall have a national anthem. Then in the next few minutes, do a few introductions, then we get to the meat of the day. Tell a little the meat of the day. Tell a little the meat of the day. Are you ready for war? Come on, so ladies, you can feel that bass. You can feel that bass, that morning bass. Are you ready for war? All right, allow me to request Eric to pray for us. Then a Muslim volunteer, Muslim. Volunteer mostly. Volunteer? That's what a volunteer, not select. One of these people will call. The problem is now you are. Yes, come.
Father, in the name of Jesus, come before your presence, this day and this hour. Thank you, Father, for the light of this lecture. Father, there was a plan from Father, and this is the day, my Father, my God, you have wanted joy for the Kenya medical national symposium, of God. You know, Father, my God, you brought joy to start this is God. And Father, we do that, God. We have, my Father, my God, students here, my Father, my God, we have our own lecturers, my Father, my God, and the expertise, my Father, different fields, God. We pray that you lead us all everlasting God, joy. My God, guide us, my Father, my God, in the wisdom of everlasting God, joy. It's a panel, my Father, my God, it's a platform, joy, for everlasting God, joy, growing together in this week, God. Help us and lead us, joy. As we start from our hands for God, we call upon support. In the name of Jesus Christ, joy, Jesus, my Father, my God, allow us to get a prayer. Amen.
اللهم زدنا علما وفقنا واشفنا اللهم زدنا واغفر لنا وارحمنا واسقنا في الجنه واشفنا اللهم المسلمين اللهم زدنا علما وفقنا برحمتك يا ارحم الراحمين صلى الله على محمد واله الطيبين الطاهرين.
Appreciate them for me. So I will request us out of our own comfort seats to stand up for the national anthem. Thank you. Thank you. Yes, in the honor of the national anthem of our national prayer, let us be at attention. Yes, attention. It's just an honor of our national prayer. And we'll only do one stanza in English, then the East African anthem. We shall be ready for the event, okay? So, O God of all creation,
blessed is our land and nation, justice be our shield and defender. May we dwell in unity, peace and liberty, plenty be found within our borders. Jumuiya ya Afrika Mashariki tuwezeshe kuishi kwa amani, tutimize malengo yetu. Jumuiya yetu sote tulinde, tuwajibike, tuimarike. Umoja wetu ni nguzo yetu.
we can have our seats. Just like you're falling into love, I don't know if you laugh as well. But as an MC, you hide your laugh in my rib, okay? So I had to keep my laugh in my rib because guys are biting tongues. I thought we are ready for East African Symposium next year. Are we ready? I want to bring Tanzania to Kenya and Uganda. Are you guys ready? You cannot be ready when you don't know the East African anthem. Jamani, how can you be ready if you don't know the prayer of the community? Are you ready? Yeah. Are you ready? Let us see the outcomes, then we shall speak to that, okay? So we're going to have just brief introduction, and we're going to get this from the chairs of the various clubs. We have JKUAT in the house. JKUAT in the house. You can't do that here. You can't do that here. Not when I'm the MC. JKUAT in the house. JKUAT. I think they're yet to come. JKUAT is a research lab around here in JKUAT. JKUAT in the house. Kikuyu. What's the difference between little and me? What is the difference between little and me? They are all the same. There is no R in your curriculum. JKUAT in the house. JKUAT. Biochemistry students. I think they're on the way. JKUAT. On the way. JKUAT. Microbiology students. We have a representative here. Very nice. JKUAT nursing students. They promise to come. Not yet. Pharmacy students. Society of Pharmacists. Do you have any? Not yet. Clinicians. I think I saw a test from them. LMSK representative here. Kirundo. Kemelsa. Some energy for Kemelsa. Okay, it's interesting. Because by de facto, you're a member of Kemelsa. You're going to understand that later. By de facto, as a medical laboratory student, you're a member of Kemelsa. Kemelsa is Kenya National Medical Laboratory Students Association, right? So by the fact of you being a member of any club in the laboratory medicine field, you are a de facto member of Kemelsa. So when I say, let's have some energy for Kemelsa, it's typically saying that let us have some energy for ourselves, okay? So Kemelsa, it's going to be explained later. We have the executive around here. I'm part of that conversation. I'm also around representative. Okay, that one's going to be dealt with later. So allow me to welcome. Yes, I'm sure the different clubs have the leaders here. I'm going to allow a minute, extremely exclusive 1 minute. KMLTTB, yes. I think we have a special recognition part for him. We're going to take care of that. KMLTTB is in the house. I think that promised some people, right? Appreciate it. Yes, I don't have some more concerning the Dixie cards. The thing to look at the photos. You guys complain to me, it's going to explain that to you. They look like our national like this. The man is still. He's going to take care of that with a lot of things, I'm sure, because we requested him to take care of it. Alright, so we request Akuma's chair, Mkumsa, this is Mkumsa, Transfusion here there. And all those chairs, just come, all of you come on board. I'm going to give a minute for you just to represent your students, then you allow us to begin the symposium. Chairs from the different clubs, especially outside, just come on board, same time, chairs. Appreciate them. All right. Which club? Chairs, exclusively, please. Chairs. No, that has this moment. Thank you. You have 1 minute and I'll be counting for today, no jokes.
To our guests, fellow students, good morning. Good morning. Yes, my name is Vincent Wari. I'm the chairperson to Medical Laboratory Students Association. Yes, this is a good opportunity for us to share knowledge, share insights and gain some experiences. So I think we are going to meet in the business symposium as our teams to be here. Never disappoint.
A panel of lecturers and the MLS students belong to observe all protocols. Good morning. My name is Zuguna Adu from Oranga University of Technology, taking medical sciences undergraduate. So I'm the chairperson, MUT Medical Labs Association, and allow me to threaten you by saying, I'm here with a strong team.
Thank you.
Good morning. Good morning. Our lecturers, our fellow students, medical students as well as I'm aware there are some BCG pharmacy students as well. I extend my gratitude to you for allowing me this chance to talk to you today. My name is Albi Hussein and I'm from Kenyatta University. I'm the current president in charge of the association, Academic Association of Kenyatta University Medical Laboratory Students. And one thing I can assure you, wholeheartedly, not even 100%, 105% even, I brought the best of the best.
All protocols observed. My name is Gordon. I'm the chairperson of Great Nkumulsa. I'm happy to be part of it today. And my team is dedicated for this saga. I believe that I have brought my best, and I'm very grateful. Thank you.
All the way from the heaven of opportunity, counting your 1, 2, and you're only counting with our orgasm. Medical Laboratory Students Association. And you need to go down and see You've got the better across the relax. Thank you.
Good morning. So I'm a member of Tony, a member of KMLTTB University, under the Department of Medical Microbiology, JKUAT. I know most of them are not already, but they are on their way. And I promise you, together with MLS, we are going to be great achievers, and you are going to witness it. Thank you.
Welcome to this house. Good morning. My name is Parasitology. I'm the acting deputy chair for KMLTTB. So, to me, I've come for competition. I've come to learn. And being the chair of chairs, I've come to witness what each and every institution is going to showcase. And lastly, I want to say that I'm very grateful for the JKUAT, for the organization. We've been together with that, and I'm very grateful for this. Seeing this team in front of me here today is like an ambition or a dream achieved. Because when you started the partnership of reaching out to universities, JKUAT was the first place we came to. When I was the chair for Academics, I'm a 5th year by now. You may not understand that I'm a 5th year by now. So when we started by JKUAT itself, by the moment they first received their certificate of registration of JKUAT, we went to UOM, we went to MKU, we had our first meet, and we had a good number of joint events in the previous symposium. And this symposium again bringing even better. The KMLTTB team on board are very much humble. And please, as we leave this place, we leave this platform to you. I want to talk to all the students from. As one of my dads, let me call him the dad because I'm 50 years by now, is that keep the fire burning. You have a lot to achieve. Once you try our best as KMLTTB, you try to reach to the board, you try to reach to the MOH and all of us, all the lecturers who've been in contact.
We are so much engaging, and all this is for your best. So what we want to tell you today as I did my 5th year and I'm finishing my studies is keep the fire burning. There's a lot of progress to do. Asante sana.
Nimesikia kuna wenye wako na nyota, mwangaza, yaani kuna wenye wako na best, kuna wenye wako na winners, lakini mambo kwa ground sitakuwa namna hiyo. Sitakuwa namna hiyo. Kwenye nafasi hiyo. So let us see who is the real deal in the next few minutes. Yeah, the ground has been shaking here and there. Let us have some solutions here. The solutions have been given to us. Let us have some solutions from our chair and course. Come on, we solve a few things here and there. Go back. You cannot do chair such a welcome. Please, I want to appreciate you in my club. I'm going to be a check last week. This thing has been the drive of this thing. I'm a Secretary General, but it is the chair. I have to report to the chair. Even this morning, I had to report to chair. Yesterday, I had to report to chair. Chair, we ready. So, how can we give you 2 claps? I'm going to be judges of any meeting. You can see still, unaona, hata kama nyota iko. You can see. So, I want us to appreciate our chairman, Minister Radak Sami, as he comes forth to give just a few welcoming remarks at the concert, then we shall be going to go, alright? So appreciate him as he comes.
Dear esteemed fellow colleagues, I would like to observe the protocols. Thank you so much for us taking your precious time and deciding to honor this great event. It wouldn't be a great event if you decided not to honor it. It is you that is a great person and you are the one who makes this event great. And I would like to really appreciate that. I would like to appreciate each and everyone. On to my introduction. My name is Radak Sami Kokor. In school I'm called Minister Radak, there are some reasons, but I also call myself the earthquake that trembled the stone, or the lightning that shook that stone. I really want to tell you that it is going not to be easy. You can take the mic and say anything you want, but I want to say this. JKUAT. Is it going to shake? JKUAT. Are we pretending it at home? Are we allowing anyone to take it to them? It is remaining here, and I want to tell you that the grounds are not going to shake because we are the ones that shake the grounds. Thank you so much.
The grounds are not going to do what? Because we are the one. In fact, I will say it better. The grounds are not going to change. We set the face already, you know it. Right? This is how we're going to do it again today. To make the face even go far. So, I am the equals and not an increase. That's not going to become my equals. Let me now come back to my job. It's just the video. You have something. I want our lecturers, before they shake the grounds, they shake the feet as well, so that the ground is going to be ready for some more shaking. Alright? So how do you feel? Let's get on the game. How do you feel? Because people have set the air rough. Ask them how do you feel? Unaona mwangaza, kuna nyota kama watu wa mwangaza. Ask them how do you feel? Are you okay? Are you okay? Is the brain okay? Ask them if the doctor is okay. Before you go to glucose levels, that's when the dopamine levels are okay. Yeah, is the neighbor talking to you or is anxious already? Yeah, wacha baridi. You are ready. Okay, DJ, I'm ready when you're ready for DJ. Is the neighbor talking to you? The neighbor is talking to you? Alright, I want us to do one activity because DJ, you okay? Very nice.
You have a request from the DJ that has been outstanding. The symposium is already up. Coming in the next few minutes. We're going to pick our numbers from our matron here. It's going to be very random and fair. Then after we pick our numbers, we're going to have the real deal on the ground. DJ 20 basi, people can be upstanding. Let us be upstanding. Let us be upstanding. JKUAT, 30 seconds JKUAT, 30 seconds JKUAT, 3, 30 seconds JKUAT, KU 15 seconds, KU 15 seconds, KU 15 seconds, KU 15 seconds, 1, KU, MKU, appreciate MKU, KU 15 seconds, KU 15 seconds jamani. KU wako wapi jamani? Watu wa mwangaza, leteni nyota. Leteni nyota. Watu wa mwangaza, leteni nyota jamani. Aya tuk. The only school in the CBD. You must be good dancers. Hawana dancers. Aya sawa, tumemaliza hiyo. MKU mko? KU. Tuk, appreciate tuk. Appreciate tuk. KU. Mwangaza. Very nice. KU. KU bwana, to waste time. Hamna dancers. KU. Aya DJ, eka hapo beginning, eka hapo mwanzo. DJ eka hapo mwanzo kidogo tu. Kidogo DJ. Are you guys ready? Muranga. Ado Muranga muri okuo. Okai Muranga. Muranga bao. Oto Muranga. Muranga. You know those dondas who say it. Muranga kama hakuna, achana nayo. Haya, Muranga kwa wapi? Wako wapi watu Muranga? Hands up Muranga. Muranga. Wewe, Muranga. Watu Muranga kwa wapi? DJ shikilia. Watu Muranga 15 seconds. DJ shika kabisa, shika. Muranga, if you're not coming, we're going to find you. Tutawafine, watu Muranga tutawafine. Muranga. Wana Muranga. Muranga adwa nyoba. Hey. Karoheni. Very nice. Nimelani language juzi. DJ. Wacha tuone. DJ nawapatia 15 seconds. Shikilia DJ. Instructions. DJ is going to give you 15 seconds each. 15 seconds each. 15 seconds. Then round 2, you're going to have 10 seconds. Then tukafunge. DJ, nipatie 15 seconds wa kwanza KU 20 basi. DJ shika. Angusha DJ. Haya basi. KU hapo. Achia shika hapo DJ. Haya MKU angusha DJ MKU. Angusha MKU. Haya basi. Chukua hiyo.
Yeah.
Haya basi. Acha tuanguke CBD before tuende kwa watu wa Morangas, ndio? Haya DJ angushia CBD.
Yeah.
Nyonga hiyo. Nataka mpokee nyota. Si namna hiyo? DJ patia watu wa nyota pale, watu wa mwangaza.
Pole ni kuibembeleza. Nini tofauti man? Mbembeleza.
Haya. Amepokea nyota, si ndio? Mmepokea nyota. Wacha tuingie hapa watu wa Karuheni, hapa Murang'a, si ndio? Murang'a, kastrope ya Murang'a ni nini? Sikia, kastrope ya Murang'a ni nini? Tuanguke hapo. DJ angusha yeye hapo.
Katika. Inengia. Makofi.
Pick up on DJ. I can see Baba is a good motivation. Style zake ziko kila mahali, si ndio? Namna hiyo. Haya DJ. JKUAT uko tayari? DJ angusha JKUAT hapo. Haya basi.
That big I know they too like those.
Haya. DJ nyonga hiyo. One for the team. Nipatie miondoko tayari. Tayarisha miondoko. Hata penye huko pia unaweza chukua miondoko, si ndio? Are you ready for miondoko? DJ, I'm ready when you're ready, DJ. I'm ready when you're ready. Are you ready for miondoko? Tayarisha misuli bwana, tayarisha misuli. Haya basi. DJ when you're ready, direct it. Bwana basi. Amuka. Kila mtu. Tupatie kila mtu hapa. Yes.
Come to the dance floor, baby. Now do the best, banga. I'ma do it your way. Yeah, watching you to stay. Pussy, you go, baby. Now nothing less. Now make it show it.
Mwisho basi shika hapo. Wacha tuulize DJ, uko na miondoko DJ? Uko na miondoko? DJ hana miondoko lakini atatafuta. Sawa. You can appreciate them as they take their seat. Have you enjoyed? You've enjoyed? Mmejibamba lecturers ama tuwapatie yenu? DJ haiwezi enda hivi. The game was almost rigged, but before they rig it, DJ tupatie lecturers. Wacha tuone style za baba hapa. Hatuwezi enda hivi. Haiwezi, simekubali. Tuone lecturer yupi mnoma, si ndio? Haya basi. Tafuteni volunteers watano wakuje hapa. Kila university kama kawaida Wote? Wote kujeni mkuje. Wote mkuje. DJ tafuta lecturer bwana. Wote mkuje, kujeni tu, kujeni. We must have fun. Kujeni. Nataka Haya. Wacha wote wakuje. Nataka mniangalilie wote. Mnapokea nyota nyinyi nyote. Nyota. Wote wapokee nyota, si ndio? Haya basi kujeni. DJ nipatie hapo. Haya. Mko na request? Nipatieni request yao. Ngoma gani? Enjoy. Ngoma gani? DJ ana miondoko. Ngoma gani? Haya DJ wapatie basi, acha tuone. Haya DJ bwana, I'm ready when you're ready. One at a time. DJ shika DJ. DJ shika. Na ngoja DJ. I am bringing a few on board, sawa? Sawa? And one, we are beginning with JKUAT. Si mwache matron atupatie. DJ mpatie yake 15 seconds. Nyonga hiyo. Watu wa Mwangaza mko wapi? Ako wapi wa Mwangaza? Nataka tupokee nyota. Haya basi DJ mpatie. DJ. DJ. Naona mmepokea nyota nyinyi nyote, si ndio? Haya, tuk CBD nani ana represent CBD? Kujeni nyote wawili. Mko wawili kujeni kama mko wawili. DJ give them a number. Wote nyote kujeni. DJ wapatie. Hiyo imeenda. Haya basi. MKU najua kuna dansa satari. DJ tafuta DJ, ngoja. MKU anguka kwenye utosi. DJ mpatie. Kama DJ yana tunamwimbia, si ndio? DJ I'm ready when you are ready. Naona leo mnajibamba sana. Niliambia dopamine lazima ipande. Haya twende basi. DJ fika hapo. Shikilia. Sikiza hii. Xing shong sha. Xing shong sha. Xing sha. DJ mpatie. DJ mpe. Xing shong sha. Yeah. DJ shikilia. Naona ni kama mnarushiwa matao nyinyi wote. Mbona mreceive bwana? Zinakuja hivi na mchukui. Sasa mnachukua pia. Nataka nani huyo? Muranga. Adwa Muranga muri okuo. Hebu kigosho hapo DJ. DJ, hatuwezi fanya hivi. DJ, kigosho uko nayo? Adomora kidogo apatie kigosho. Mnajua kigosho? Haya basi, hakuna kigosho, lakini watu wa Murang'a anguka kwenye utosi. Haya DJ, shika DJ kwanza, shika. Anza sasa DJ, wacha mchezo. Haya basi. Chukua hiyo.
Nobody like work, but you must hustle if you want to. You not finish them.
Shika. Hii game imeibwa. Hii imeibwa. Tuite Museveni ama tuache? Tuite Museveni ama tuache? Nimeambia niulize our senior, our partner here. Do you know Jack Chang? You know how about Wuhan? Taiwan? Wuhan? Interesting. They can have their seats. Appreciate them.
We not go far, we go down. All of the blessings for the mind.
Are you guys having fun?
Blessings for my.
Are you guys having fun? Yeah, DJ Shikilia. Even as you have fun, remember we are here for the Kenya National Medical Laboratory Symposium. It's held here at the Assembly Hall JKUAT, and we are about to begin, all right? We're about to begin, and we are live on Discover JKUAT. If you can take a minute, I think the link is ready for all. Yeah, just take a minute. You can post on your status. Let them know it's about to go down. Tell your neighbor it's about to go down. Are you talking to your neighbor? Tell your neighbor it's about to go down. Yes, just share the link. Everybody has a bango. Kila mtu ako na hii. Okay, so mtasotiwa tu in a few. It's about to go down. So I request the universities to come on board. Hey, sasa. Hey, okay. To come on board. Do you have a representative, or how are you going to do it?
So good morning again. Are you ready? I think not already. Are you ready? So first give me a representative from each and every university. One person. Just one. Anybody, a volunteer, just to pick numbers. It's not for questioning, eh? For picking numbers. I want you to pick numbers. MKU we have? MKU, where are you? Took? Muranga? So this is how we are going to do it. Okay? So listen to the rules very, very carefully. So we'll have two panels at first. So we have two numbers. Number 1, 2. Okay? So if you pick number 1, you're in the first panel. Your university in the first panel. Okay? If you pick number 2, your university is in the second panel. Okay? So we have round 1, 3 universities. The judges here will be giving you questions in the 6 thematic areas. That is histocytology, clinical chemistry or biochemistry. Then we have microbiology. Some of us call it microbiology. Then we have parasitology, entomology. Okay? Then we have blood transfusion, and we have hematology. So each thematic area will have 5 questions. Each will have 5 questions. So we'll give you a few minutes. I think 2 or 3 minutes, we'll decide. So once we pose a question to you, you can discuss among the 5 of you. Okay? Among the 5 people who are there. you give us an answer. If you get it right, you get 10 marks. Okay? If you don't get it right, you get a 0. Okay? So the first 111 will be in the first panel. Then the second 222 will be in the second panel. Then we'll pick number 1 from each side. We'll call it panel 1 and panel 2. So number 1 in panel 1 and number 1 in panel 2, they go, the 2 of them. So we have a winner and a number 2. Then we'll have number 3, 4, 5, and 6. Okay? Yeah. So all the rules understood? Hey, it's getting interesting. We have Kisii University in the house. Kisii University. So I'll give him a chance just to say hi and you tell us how you've come.
Hello. I feel so good to be among my colleagues. My name is Makori. I am a student at Kisii University. We are about to launch our own association, just like you. We are currently on attachment, the 4th years. I am currently attached at Thika. My friends here, my colleagues, so far there are 2. We have others who are coming. They are attached within Nairobi. So after hearing this good news, we decided that we will be among you. That's where we are here. We are very glad. We are hearing what you are trying to do and we are trying to catch up with you. Asanteni sana for the warm welcome. Others coming. Before, I need to recognize the ones that are already here. Yeah. One of them is Catherine Jerry, attached at Kenyatta University Teaching and Referral Hospital. The next is FCBA. She's also attached at the same facility. Other 2 are coming. Asanteni sana.
Ask you before you sit down. So are you going to take part in the competition? Umesikia hiyo? Umesikia hiyo? There are only 3. Okay? Others are coming. So we have to redo it a little bit so that we can include them. Okay? So we are going to decide on how we are going to do it. So most welcome Kisii University, and we are happy to have you here. So you can, have you given them the numbers? Number 1s? Number 1, this is took the CBD University. Then we have Murang'a University, Adwanyoba, they are here, and KU, okay? So let's have the first 5 students from each those 3 universities. Take your seats. So we can start with microbiology, parasitology. 5 students. I have told you Technical University, Murang'a University, and Kenyatta University. Okay? They're in the first panel. Kindly 5 students for microbiology, microbiology. We start with microbiology, eh? Yes, we start with microbiology. So 5 students. Haraka haraka, si mulikuwa mmejipanga? Then the second panel will have Jomo Kenyatta University, Mount Kenya University, and Methodist University. So we'll fix. Then you will be 4. We'll put you 4 in the second panel. Okay? Yes. So the second panel will have 4 groups. Okay? So let's start with the first 3. 5 students. Murang'a University, Kenyatta University, and TUK. Yes. Yes. Start with my bro. How you do it, eh? Okay.
Nani anaongea na mic? Mwenye ako na content.
They want to start?
Ndio tunasema tukipoa.
Hata tunasema run. Question ya pili, you start from there. From the middle, then you start from
Leteni simu nifunge. Tunaambia
We have Moranga University here. Took, where are you? KU? If you decide to be 3, it is okay. If you decide to be 2, if you decide to be 5, but a maximum of 5. Okay? We have a maximum of 5. So this is how we are going to do it. So we'll start with Moranga University. First question. We give the second question, the third question. Okay? Different questions. We're asking different questions. So if they don't get it, we don't give it to another group. Okay? So we'll be asking 3 questions in microbiology, 3 questions in parasite, 3. Okay? Then another group, the other group will come for hematology, 3. I am saying we are starting with microbiology. Okay? So we ask 3 questions. Okay? Then we go to parasite. We go to parasite. Another group comes in. Not the same group. So you have to be very fast. Okay? Mujieke kwa hizo groups. You put yourselves in those groups. So if you know you are in hematology, be in one group. Mukae pamoja. So that when we call you, you be very quick to come. Okay? You organized yourselves into 5 different groups. 6 different groups. Indio? We have 6 different groups. So, once we give you a question, you can discuss amongst the 5 of you. One person will come and answer. Okay? So once we give you a question, you can discuss, give us an answer very fast. Okay? So if you're out of time, so we'll give you 2 minutes. Okay? 2 minutes. Yes? Use the mic.
2 minutes to answer or discuss. So within the 2 minutes, we should have answered.
Yes. Within the 2 minutes, you discuss and give us an answer.
Thank you.
Okay? Ati? 3 minutes.
Yes. Yeah.
So how many are for 2 minutes? 3 minutes?
5.
Have it. Okay? So we give you 3 minutes. Okay? And we are timing. So if your 3 minutes zikisha kama mjatupatia answer, we pass. Okay? So after this group, we'll have a different group for microbiology. Yes. We'll have the other set of students, Jomo Kenyatta and the rest, you come, we ask you microbiology, we finish with microbiology, okay? Then we move to the next unit. That's okay. Okay, then I think we can start.
I have a question.
Yes?
I will propose that when the minutes of discussing are over, you tap the table so that we answer. Ndio tujue time ikiisha. We don't have the timer ourselves.
We have our timekeeper.
Yeah, that's so that he
So
taps.
the 3 minutes is ikienda kuisha ana tap.
Yeah.
So kama 3 minutes. Okay, ikifika 2 minutes, we tap. So you give us an answer. So the other 1 minute ni ya kutupatia answer, okay? So if you don't give us an answer within 1 minute, we give it to the next group. So I think, are you ready now? So you can introduce the group so that they can chap. Introduce your group. Mtu moja. Yes. Moja angekuwa nyingine hapa. Yes. Just tell us your group members.
Good morning, members. Murang'a University of Technology, Microbiology. The names of the members. Okay, thank you.
Kenyatta University Microbiology team.
Thank you.
Technical University Microbiology.
Thank you and welcome.
So I hope you're ready. Go get right into it. My name is Mary from Mount Kenya University. We have Dr. Karanja here representing microbiology. He's going to pick a question at random. We are going to start with Murang'a University Technology. He's going to pick a question and you are going to answer in the 3 minutes.
Thank you. Hello. The question is as follows. Give an example of bacteria with the following shapes. 1 comma shape, and the other one bacilli.
So the question reads, give an example of bacteria with the following shape. 1, comma shape. 2, bacilli. Feel you're ready? Give us the answer.
Comma-shaped Vibrio cholerae, the bacilli, lactobacilli.
So, that was MUT. We have KU, right? Okay, KU. I'll read the question for you. Pick at random. And the question reads, state the characteristics of coliforms. State the characteristics of coliforms. Let's not have writing materials because you don't know what you have written there. So, and even the phones should not have phones. Yeah. Time is always up, is almost up. 1 minute left.
Okay, so characteristics of coliforms, we have they are gram-negative, they are lactose fermenters, they are inhibited by bile, they are bile salts, to be specific, they are cultured on maconchi agar.
Thank you very much. We now move ahead to Technical University of Kenya, if I'm correct. Then
The question for the Technical University of Kenya, the causative agent at the diagnosis of Bacillus dysentery. You have to give us the causative agent at the diagnosis of Bacillus dysentery.
time is always up, it's almost up. Is it a minute, less than a minute? You should be answering or you get a 0.
So, under diagnostics, you do culture for, let's say the specimen is a stool, you do a culture and then you do gram stain. The causative agent is a lactobacilli species, which causes lactobacilli dysentery. Thank you.
wait. Two more questions coming your way. So second question from Murang'a University.
Mulanga University, second question. What is the use of flagella in a bacteria cell?
Silence, please. Silence. Maintain silence. Please, silence. Questions are picked at random.
So the use of flagella in bacterial cells is for movement and locomotion.
Okay, you're next.
Your second question is, name 4 phases in bacterial growth curve.
Hello? Okay, our answers. The first phase is initial phase, then exponential stroke log phase, then lag phase, then we have intermittent and latent phase.
Two, get ready. Question for Took. Give 4 infections caused by Staphylococcus aureus. Give us an answer, please.
So Staphylococcus causes urinary tract infection, dermatitis, cavernicles, and cardiovascular blockage.
Okay, we move fast to MUT. The next question. The next question, the third question reads, describe the laboratory examination of urogenital specimens. Describe the laboratory examination of urogenital specimen. We are ready when you're ready.
Urogenital specimens, we have a vaginal swab, urine and urethral swab. Diagnosis, we can do wet prep and microscopy, gram staining, culture and sensitivity.
Thank you, Muranga University. We move on to KU.
Okay, that question is as follows. Two toxins produced by Streptococcus pyogenes.
So the two toxins are PV leukocidin and streptokinase.
Took. Ready? The question reads, gram-positive cocci in chains are known as? Gram-positive cocci in chains are known as?
Streptococcus.
So microbiology session for panel 1 is over. We move on to panel 2. Panel 2. Thank you so much. So welcome. We're not going to take so much time. Introduce yourselves. Each group to introduce their members. Say from which institution you come from.
Good morning, Mount Kenya University Microbiology.
Good morning, Microbiology team, JKUAT.
Good morning, Kisii University Microbiology.
Morning, Microbiology team, Kenya Methodist University.
The first question for MKU, Yersinia pestis causes which disease? Yersinia pestis causes which disease?
Okay, the answer for that, Yersinia pestis causes Black Death disease.
What answer did you give?
Black Death disease.
So we move on to the next. We have JKUAT. JKUAT? So JKUAT, whooping cough is caused by which bacteria? Whooping cough is caused by which bacteria?
Bordetella pertussis. Bordetella pertussis.
You said?
Bordetella pertussis.
For KC University, the first question, differentiate between prokaryote and eukaryote cell.
Give us an answer, please.
Prokaryotic, they have a cell wall. Example is bacteria, but eukaryotic, they don't have a cell wall. They are nucleated, and then they have organelles, like we have fungi and human beings.
We have a special guest. Yes, father in medical absence, he's taught us all. It's Dr. Waidaka in the house. So we move to KEMU. The question reads, thiosulfate citrate bile salts, sucrose agar, that is TCBS agar, is enriched media. Is it yes or no? Or true or false? Thiosulfate citrate bile salt, sucrose agar is an enriched media. True or false?
For chemo, it's false. It's a selective media.
That's good.
For MKU, sorry, for MKU, the second question, camp factor. Camp factor is produced by which pathogen?
Okay, the answer for that is Streptococcus agaractiae.
JKUAT. Differentiate obligate anaerobe from facultative anaerobes in organisms classification. Differentiate obligate anaerobes from facultative anaerobes in organisms classification.
Good morning. For JKUAT, the answer on the difference between obligate and facultative anaerobes. For the obligate anaerobes, it means that the organism requires, it's a must, for carbon dioxide to be present for its growth to be possible. But for the facultative anaerobe, facultative means it can do with or without. So facultative anaerobes can grow both in the presence or without the presence of carbon dioxide. Thank you.
Kisii University.
The question is as follows for Kisii University. 3 types of antigens possessed by Enterobacteria C group. You give us 3 types of antigens possessed by Enterobacteria C group.
Good morning. For Kisii University, the answer we have is capsules adhesins.
What was the last answer you gave? Capsules and?
Adhesins.
Next question. Name the main action of moist heat physical methods of sterilization. That is KEMU. Name the main action of moist heat physical methods of sterilization.
So for KEMU, under the main function of moist heat under physical methods is to inhibit the synthesis of proteins so as to the growth of microorganisms. Like the main function of moist heat is to inhibit the synthesis of proteins so as to kill the microorganisms from growing.
So the last, thank you, Kemu. We go to MKU. I'll read the question for MKU. Mycology is the study of
Mycology is the study of fungi.
JKUAT. Give one organism that is sensitive and one that is resistant to optochin.
An example of optochin-sensitive bacteria is Streptococcus pneumoniae, and non-sensitive, an example is Streptococcus viridans.
The third question for KC University. Explain the pathogenesis of Corynebacterium diphtheria. Explain the pathogenesis. Let me repeat the question, please. Explain the pathogenesis of Corynebacterium diphtheria.
KC University, It is an upper respiratory infection. One acquires the infection through it can be acquired through respiratory droplets, and then it is a The infection is acquired through inhalation of the droplets. It multiplies in the lungs, and then it can pass to other individuals via the inhalation of the droplets. Thank you.
We move to the next group, KEMU. Laboratory diagnosis of Klebsiella species. Lab diagnosis of Klebsiella species. Give us an answer, please.
Okay, for KEMU, the lab diagnosis of Klebsiella pneumoniae, you take the specimen which is a throat swab, then you can do the microscopy, whereby it appears as gram-negative bacilli. Then you do cultures, and there's a Q-lung reaction, whereby it shall show the swelling, a capsular swelling. Yeah, thank you. And for INVIC, the indole test will be negative. For the Medei red, it will be negative. For the Vogus Proska, it shall become positive and citrate positive. Thank you.
So we're done with microbiology session. We take your seats, then we go to parasitology. Matron JKUAT.
Very nice.
Matron JKUAT, you can continue the coordination.
Mambo iko sawa?
Iko sawa.
Mambo iko fiti? Mnasikia fiti? Lactobacillus ricketis kata iko sawa? Very nice.
And we hope, Stan, you are in one of the panels. Huh?
You are right. But next time.
So we have our next round of questions. So we move to parasitology, entomology. Or? Oh, sorry. We don't move to that. We've moved to hematology. Hematology, some blood. So let's have this. Which was the first panel? MKU? Sorry. Yes, we are moving to hematology. Yes, hematology. MUT. Took. NKU. Chap. MUT. Not JKUAT. KU and took. Five of you. Yes. Tafadhali, we make it a bit faster. Si mulikuwa mmejipanga? So I can see we are ready. So I'll give this chance now to the panel of hematology and blood transfusion.
Good morning.
A minute. This would be very, very wrong. Stan, want to recognize the presence of Akamulso. So I hope, and it is my wish, that we all know the meaning of Akamulso. You don't? We'll get to know it. It is an association. It's the body. It is an association that holds all medical lab staff, professionals. Okay? Then KMLTTB is the regulator. Okay? So we have both of them in the house. They'll be telling us more as we move on. Karibu sana. Daktari, did I recognize you?
Now, good afternoon. All is well. I don't want to talk much because if I talk much, you might forget what you have. But I'm very happy this is something I had 20 years ago, that one day, one time, you have this kind of an event. Thank you.
So when you see Daktari there, he has taught, I think, all of us. That is how serious it is. He taught some of us when we were very small girls. Now we are big.
Good afternoon. So panelists, we request that you introduce yourself as a team so that we know which group is which one. We start from this side.
Good morning. Mko poa? Hii ni Technical University of Kenya.
Thank you. The next.
Good afternoon. A team from Kenyatta University.
You. Welcome. Technology.
Hi, Muranga University.
Thank you. Thank you. So we begin the questioning, hematology, from this side, Muranga. The first question. You have still 2 minutes? 2 minutes to discuss and answer your question.
This is the question. The presence of Reed-Sternberg cell confirms that one is suffering from which condition? The presence of Reed-Sternberg cell confirms one is suffering from which condition?
Good morning. The answer we have is macrocytic anemia.
All right. So for the next group, KU, question for you. Philadelphia chromosome is demonstrated in which hematological condition? Philadelphia chromosome.
The answer is beta thalassemia.
Took your question. It is true that, sorry, is it true that homeostasis is the mechanism which keeps blood in fluid state in circulation?
Yes, it is true.
Back to Muranga. Back to Muranga. Your question 2. Let me mix. You can pick one. Outline the osmotic fragility test. Outline the osmotic fragility test.
On outlining the osmotic fragility test, the test is used. Sorry. The test is used to detect for any red cell abnormality. We have red cell. We have the samples, which is the blood sample and the saline. So there's a tube where we have the uninoculated saline. There's a tube where we have 3 tubes. So the saline solution is hypotonic to the red cells. So in case, so the molecules of water will move to the red blood cells. In any case, they will rupture and they cause hemolysis. So in the tubes is inoculated, and the other 2 tubes, the positive test will show full hemolysis. Also, the hemolysis begins at 0.32% and ends at 0.47%. Yes.
Thank you. We move to the next question for KU. Second question. Name 4 classes of leukemia.
4 types of leukemia. We have acute myeloid leukemia and chronic myeloid leukemia. Then we have acute lymphoid leukemia and chronic lymphoid leukemia.
The next question for Tuk. Bohr's effect is one of the factors enhancing, not the function of hemoglobin. Yes or no?
We can rephrase. Bohr's effect is one of the factors enhancing, not the functions of hemoglobin. You can either say yes or no. I'm being told to repeat. Bohr's effect, that is B-O-H-R apostrophe then S. Effect is one of the factors enhancing, not the functions of hemoglobin.
Yes or no?
Yes.
Thank you, thank you. The third question for Muranga. Third question for Muranga. People with beta thalassemia major have increased HbA. True or false? Beta thalassemia.
The answer is yes.
Third question for KU. Outline the process of thin blood film reporting. Outline the process of thin blood film reporting.
Disconnect.
So my phone is safe here. Can this go to?
time to answer.
Time is up. Okay, pass. Time is up. The next group.
Okay, so reporting of our PBF. First thing, angalia cell distribution. So you look at cell distribution. If there is Rolex formation, maybe agglutination. Second thing, you look at color properties, the stain intake, maybe. If it's hyperchromic, normochromic, or hypochromic. Then you look at cell morphology. If there is microcytic, normocytic, or macrocytic. Also, anisopoikilocytosis under cell morphology when you are reporting. Last thing, you look at inclusion bodies, hence bodies, siderotic bodies. Thank you.
Thank you. Third question for TUK. Yes. Outline the bleeding time test. Outline the bleeding time test.
Mose. Sasa so nilikuwa nataka uachiwe Kid na Esther ama hata huko around.
So the bleeding test, the bleeding time testing. So what we do, it's like I prick my hand, right? Then stroke my finger, it's the same. Then ile masaa, yeah? The time it takes. So normally we can say it's like 30 to 2 minutes, so it's normal, right? But if the bleeding continues without any clot formation, unajua hapo kuna ngori.
Are you done too? Okay.
Okay, allow me to make a classification. Okay, bleeding time test is used to determine bleeding disorders. First, you make just a slight insertion on your hand. Then you use, let's say, a filter paper. So in a bleeding time test, you're observing the time taken for example, when your skin is ruptured and your cells are exposed to outside environment. So bleeding, we will determine the time taken for the conversion of the whole process of cascade pathway for the formation of a cord which prevents excess blood loss. Thank you.
Okay, thank you for answering. So now that is all for the first group. Now we welcome the other group, group twos.
Well, it's getting hot. Are you feeling the heat? Are you feeling the heat? I can already feel the heat, eh? So as they come in, as they settle down, I want to recognize our two guests who've just come in. Shh, tafadhali. When it's your time to talk, you talk, okay? Now it is mine. So I will invite Professor August. She's one of our senior most staff in MLS, that is Medical Lab Sciences. So she will tell us more about herself, just to say hi before she leaves.
Hello, students. Okay, can you hear me? Yeah, it's good to see youthful energy all over the place. Yeah, I always tell my students, and they are here, they can say, always tell them, the best way to avoid making mistakes is to participate. So when I see the volunteers on stage, they are learning a lot more than you who has refused to go on stage. So by the end of the day, make sure that you participate actively. This is the reason why. Imagine if you give a wrong answer and you're publicly corrected. What does that do to you? You will never make that mistake again. And that's why I say in any gathering where there's learning, you must always participate, because that, let me call it public shaming, is a permanent lesson. So lift up your hand, open your mouth, say something, be corrected, and you will learn. If you keep quiet with your mistake, no one will ever correct it. So enjoy yourselves. I was supposed to stay for the discussion, but the program is so late and I have other engagements, but I wish you the best. Yes.
Thank you very much, Prof. She's a virologist, so she's able to see a virus even with the naked eyes. Eh? So Millicent is another one of our senior staffs in MLS. I was hoping she could have been here in microbiology, but let's hear from her what she has to say. Thank you.
Thank you, Jace. Good afternoon. Yeah, I think this thing is so good. I just came here some barely 10 minutes ago, and what I can say is that you are just being mentored for interviews to come once you finish your program. For these people who are participating here, they're getting that confidence to be able to answer questions during interviews after finishing. And from here, we can be able to get the types of professionals that we are going to come up with, because we have various disciplines here. And after that, I know you are going to get specialization in various disciplines. Like, for example, microbiology, as you're saying, virology, hematology, and the rest, yeah? So this is the place where you can gain interest in a particular discipline. I wish I was here from the beginning. I specialize in microbiology, but because I had classes in the morning, I couldn't be with you. But all the same, I'm here for a short while to give you support and to be with you. Thank you.
Some better happy claps for the two. As we wait to see the hematologist in the house.
We can start with introduction so that we know which group is which. We can start from this side.
Good afternoon. Kenya Methodist University, Hematology.
Good afternoon, ladies and gentlemen. This is KC University, Hematologists. Thank you.
Good afternoon. This is JKUAT Hematology Group.
Good afternoon. Mount Kenya University, Hematology.
Okay, pleasure. Now welcome.
So we'll start questioning from this side. MKU, your first question is, what is the meaning of INR?
So INR stands for International Normalized Ratio.
Thank you. Your first question, JKUAT. Describe the preparation and staining of a thin smear using Leishman staining.
So for the Leishman staining, preparation of the thin smear and staining. We start with the Leishman stain, with the preparation of the thin smear. So you pour a drop of blood on your slide near the frosted end, and then you incline at 45 degrees, and then you move it forward, making a smear occupying two-thirds of the slide, and with a tail and a head. After that, we are dry. And for Leishman staining, there's no fixing the slide. So we pour the Leishman stain. You flood on a staining rack. You flood the stain. The stain has some components which fixes the slide. The methanol is included in that Leishman stain. So after that, you have to wait for 3 minutes for the staining. After that, you dilute with buffered water, pH 6.8. After the dilution,
Excuse, for the sake of time, please just applause him after the presentation.
And proceed to microscopic examination of the slide.
Thank you, JKUAT. KC University, your first question. Outline Leishman staining. That's a repetition, so we are picking another question. Given that the hematocrit, in bracket packed cell volume of a patient is 51%, deduce the hemoglobin concentration of the specimen. If you need something to use to calculate, please come forward. We'll give you a pen and a paper.
Good afternoon. So for Kisii University, we use the rule of 3. So we have the HCT, which is 51. We want the HB. It's known that HB times 3 is equals to HCT plus or minus 3. So if we take 15 divided by 3, we get 17 plus or minus 3, which is the HB.
Thank you. Now, Kemu, your first question. Outline the procedure for the sickling test. Procedure for the sickling test.
So for chemo, skilling test, it's for megaloblastic anemia, for the deficiency of vitamin B12.
Before you continue, we talked about sickling. Sickling test. Sickling. SICKLING. Sickling, not the other one. No, and your time is up.
For chemo, to do a sickling test, you first tie a rubber band in your finger, then you prick, then the blood, you put it on the smear. On the slide, you cover slip, and that cover slip, you seal it with candle wax. Then you observe.
Next. MKU, your second question. The increase of certain cells in circulation leads to polychromasia. Name the cells. The increase of certain cells in circulation leads to polychromasia. Name the cells.
So the cells are the reticulocytes.
We move to the next group, which is JKUAT. LE body is a cell commonly seen in which condition? LE body is a cell commonly seen in which condition?
So for the friendly bodies, they are found in the RBCs.
Pardon? LE body.
LE.
Yes, LE body. In which condition do we find them? Cells. Cells. So, can we now move to the other group? So, this group Kisi, get the question. See this one. Outline the clotting time test. Outline the clotting time test.
For the Kisii University, the clotting time tests.
Please pull the mic closer.
The clotting time tests, it takes 2 to 8 minutes, and the procedure is, first you prepare the patient, withdraw the blood from the arm, then immediately start the stopwatch, then into 2 test tubes, equally amount, pour the blood, then immediately place the test tube in water bath, then after every 30 minutes, you shake and check for clotting. Thank you.
Okay. Next is Kemo. Take our question. Kemo, your question. Name the coagulation factor leading to hemophilia C when deficient. Name the coagulation factor leading to hemophilia C when deficient.
Deficiency of factor 11.
Back to MKU, the last question.
Outline the procedure of erythrocyte sedimentation rate, ECR, by the Western grain method.
Okay, the procedure for erythrocyte sedimentation rate as per the Western grain method. First, where we collect blood, usually, you have to assure the patient, you have to make sure that the patient is very comfortable, after which you collect venous blood and you place it in, you put the blood in a sodium citrated tube, okay? Thereafter, you pipette using Western grain tube, you pipette blood up to the 0 millimeter mark. Okay. After which you transfer it vertically to the Western grain cup. Okay. Give it at least 60 minutes, or that's 1 hour, after which you record your readings. You read the clear air portion, usually in millimeters per hour. Thank you.
Thank you, MKU. We move to JKUAT. Your final question. Discuss the organs involved in reticuloendothelial system process and their functions. If you clap, they will miss the question. Discuss the organs involved in reticuloendothelial system process and their functions.
So for the organs involved in reticuloendothelial system, we have liver and spleen. And these organs, the two organs, actually they are the major organs in production of red cells for the infant before the bone marrow takes over in production of red cells. So liver and spleen, they will take over, or there's a condition called, there's a situation called extramedullary hematopoiesis, where the liver and the spleen will revert to the production of the red cells when the bone marrow does not suffice the production of the RBCs in the circulation. So the liver also is involved in the detoxification, and also the spleen is involved in the removal of the abnormal red cells in the circulation. And for the liver and spleen, they are also used in case of an elder, they may produce RBCs in case of elderly people, or factors like viral infections that or aplastic anemia, which renders bone marrow unable to produce the enough cells in the circulation.
Thank you, JKUAT. Move to Kisi, your final question on hematology. Outline the functions and the reference ranges of red blood cells. Outline the functions and the reference ranges of red blood cells.
So this is Kisii University. The reference range for the normal RBCs is from 4.6 to 6 times 10 power 9 unit per liter. Then the functions are transportation of hemoglobin, which carries oxygen in the body. Then maintain body pH. Then it is used in the transportation of nutrients, whereby the hemoglobin also carries the nutrients. Then also we have what we call the hemoglobin is the glycolylated hemoglobin, which is used in the carrying of the AC, which is the HbA1c. Thank you. The glucose, which is used in the metabolism. Thank you.
Thank you, Kisii University. We now move to Kemu for your final question in hematology.
Outline a brief procedure of this has been repeated. Outline a brief procedure of making the peripheral blood film, PBF. That one. So it was staining. So you can carry on. The previous question was different. We thought it was similar. So outline a brief procedure of making peripheral blood film.
Yes, in the peripheral blood film, there are two types of films. There's thick and thin films. The thick film is used to study the parasites, and the thin film is used to study the morphology. For the thin film, for example, you're going to see the shape and the sizes of the cells. For these films will enable us to know if there is nomocytic cells. These are normal size shaped, normal. These are normal shaped cells. Then there is for anisochromasia, no, polychromasia, polycytosis. Polycytosis is for shape, variation in shape, and then there's variation in size. Anisocytosis. Okay, the procedure for thin film, you should take the blood and you place it a drop almost near the frosted area at an angle 45 degrees for normal blood. Yes, rapidly. So that one, you're going to prepare a thin film. If you want to prepare for a thick film, you take the blood, you take another slide evenly. Yes, there we are going to study the thin and the thick blood films. Yes.
Okay, thank you. Now we are done with hematology. Now can you take your back seat as we usher the next unit.
So I know now, we already know, we have a feeling of where we are. Okay? I can see phones are very busy, trying to see whether your school or your university got it right. Okay? It's very healthy to do that. So let's have the next panel. We are doing histocytology. 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 So we start with Moranga University, TUK, and KU. Chap, 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 chap. Murang'a University, KU, and TUK. Upstanding. Haraka haraka. MKU, sorry. Technical University of Kenya, Murang'a University, and Kenyatta University. So Madam Yudia will be taking us through.
Now we can have the groups introducing themselves.
Good afternoon. So Kenyatta University Histopathology team.
Thank you.
Technical University Histopathology.
Thank you.
God is good all the time. Murang'a University Histopath team.
Okay.
Staining living cells inside the body is referred to as
Vital staining.
Thank you.
Okay. Pulse Prussian blue technique is used to demonstrate what in histology? Pulse Prussian blue.
It's used to demonstrate iron.
Thank you.
Our last question goes to Murang'a University in the first round. Explain the collection and processing of lymph node specimen. Explain the collection and processing of lymph node specimen.
To be specific, lymph node in cytology, not histology.
Okay, good afternoon. Okay, the technique which is used is FNA as non-GINA. The technique, you start by
Introduce yourselves.
Good afternoon. This is MKU, Histopathology.
Thank you. Next group.
Good afternoon. JKUAT Histocytology.
Thank you.
Good afternoon. KMLTTB, Histopathology.
Thank you.
Good afternoon. KC University Histocytology.
Starting from KMU. KMU, the first question. Discuss faults encountered in section cutting. Discuss faults encountered in section cutting.
One minute.
So the answer is improper sectioning caused by improper ribboning caused by a blunt knife or nicks in the knife's edge. There is uneven cutting of the tissue sections, and there is the tissue stick to the knife, and then abrasions in the tissue and tearing due to improper cutting.
Thank you. First question to Kisi. Differentiate between apoptosis and necrosis.
Good afternoon. For apoptosis, it is programmed cell death. For necrosis, is unprogrammed cell death caused by bacteria. Thank you.
Thank you. Now to JKUAT.
Describe the principle and procedure of Papa-Nicolau staining method. Principle and procedure.
Good afternoon, everyone. I am Mary Waidera, JKUAT. The principle of Papa-Nicolau staining. First of all, in Papa-Nicolau staining, we have the the hematoxylin. The hematoxylin is a basic dye, and it stains the nucleus of the cell. Then we have the eosin. The eosin is an acid dye, and so it stains the basic part of the cell, the cytoplasm. And so we also have the orange G6. The orange G6 is it's a counter stain that also stains the cytoplasm. And also the procedure now, and also it also stains the keratin of the cell. It stains orange. The keratin of the cell is stained orange, and the procedure is, first of all, you will fix the smear, the pap smear. Then after fixation, once you have fixed, you will then rehydrate. You will rehydrate. First of all, you fix. Then after fixation, you'll then rehydrate. You rehydrate in the descending orders of alcohol, and then you stain with Harris hematoxylin. First of all, let me first of all compose myself. Yes, so first of all, the procedure number one is, first of all, you will fix the smear. After fixing the smear, you will rehydrate in descending orders of alcohol. That is from absolute to 90 to 80 to 60. Then after rehydrating, you'll then rinse in water. After rinsing in water, you'll then stain with the Harris hematoxylin for 15 minutes. Then after staining, you will then differentiate in the acid alcohol, 1%. And then after differentiating, you'll then bluing in Scotch tap water for 2 to 3 minutes. Then after bluing, you'll then use the orange G6. You will stain with it for 2 to 3 minutes. Then after staining with the orange G, you'll then rinse in acid alcohol, the 95%. Then after you will rinse in alcohol. Then after rinsing, you will then add the eosin aza. The eosin aza, you will stain with it so that it can stain the cytoplasm. Then after staining with the eosin aza, then you will dip in ethanol again. Then after dipping in ethanol, you will then dehydrate in descending orders of alcohol. Then after dehydrating in ascending orders of alcohol from 60, 70, 80 to absolute, then you then clear in xylene. Clearing in xylene. Then after clearing, you will then mount in DPX, and then you'll observe microscopically. Thank you.
MKU, discuss the use of fat solvents that can be avoided using the following. State the types of cells involved in the inflammatory process. Describe the types of state the types of cells involved in the inflammatory process.
1 minute.
So we have tissue macrophages, we have mast cells, we have natural killer cells, and we have the T cells. Thank you.
Now to the second round. Kemu.
Outline the H&E staining procedure. Outline the hematoxylin and eosin staining procedure.
One minute.
First, the answer is first you get the section, the tissue section, you dehydrate using alcohol on a slide. Oh, okay, you mount the section after dehydration, then you just put the section on the slide, then you dehydrate, and then now you take the hematoxylin and eosin stain, where the hematoxylin stains the nucleus and the eosin stains the cytoplasm. So you pour the stain on the slide, wait for it to infiltrate, and then wash. That's it.
Are you done?
Yes, you apply the stain and wait for it to enter the tissue, then you rinse it off, and then you view on a microscope.
Second question to Kisi.
Differentiation in hematoxylin and eosin staining technique. What is differentiation in the hematoxylin and eosin staining technique?
So the answer is you differentiate in 1% acid alcohol to remove excess hematoxin stain.
State the commonly used aqueous mounting media, their refractive index, and their application.
The answer, the most commonly used mountant is DPX, which has a refractive index of 1.5.
What? Xylene in tissue processing is used as a
So,
Bethesda system of reporting cervical cytology. Describe the Bethesda system of reporting cervical cytology. Bethesda system of reporting cervical cytology.
So, examination is, the first one is you look at the cell types. It can be the squamous epithelial cells or the glandular epithelial cells. You report on that one. The second thing is about adequacy. So the adequate, if the specimen is adequate, it is processed. If it is inadequate, it is rejected. Then the other thing is the general characterization. So at this point, you report the general characterization of how you see that smear. And then the last one is interpretation, where you interpret if it is about the cellularity of the smear. Also, you report on if it is metaplasic or not, metaplasic, yeah, and such.
For interpretation, we have where we can report at the squamous epithelial cell if it is high grade, low grade, or typical squamous epithelial cells. For glandular, we can report where it is atypical or carcinomic or carcinoma in the glandular.
Hello. I think we are done with that histocyto. We are done. Oh, you want more questions? You want more questions? No. So we have decided, because if we go for lunch, things will evaporate. Okay? So we continue with clinical chemistry. So the first group, Moranga University took NKU. Moranga University took NKU. Tafadhali, clinical chemistry. The faster you come, the faster we finish. So we'll have Dr. Waithaka taking us through that.
I'll tell them the answer. Oh, they are not there. Okay. So who is now taking compiling the marks? Hey, you are alone.
Moranga University of Technology, Clinical Chemistry.
Okay.
Good afternoon. This is Kenyatta University, Clinical Chemistry.
Technical University of Kenya, Clinical Chemistry.
Okay, let's start. Sorry. I'm sorry about that. So we have Moranga University, KU, took. Okay?
I understand that you pick random selection. So random selection, and we start with let's start with Moranga University. Differentiate between quality control solution and quality control and quality assurance. Differentiate the two. Seconds.
Okay, quality control is all procedures that are undertaken to ensure that the test results are precise and also accurate, while quality assurance are all policies and procedures that are undertaken in the laboratory to ensure that the results produced are of quality and of benefit to both the client and also the health provider.
Thank you. Just a minute. For you people, you need a heavy one. Is this KU? Yeah, I'm a alumni of KU. Okay, fine. Now this one, still on quality control. We like differentiating. Differentiate between a standard solution and a quality control solution. 30 seconds.
The difference between a quality control solution and the standard solution is that for the quality control solution, they have a fixed value and they are used to evaluate the accuracy and precision of our procedure and test, while the standard solution is used to standardize our tests. Yes.
Okay, now that is of Kenya. Now, Technical University of Kenya. Kindly, let's tell us what's blood gas test. Blood gas test measures what components? In short, can you describe blood gas analysis? The tests that falls under blood gas analysis. That seconds.
Afternoon. According to the blood arterial, we measure the gases that are involved in the blood circulation, like the bicarbonate, the phosphate. They can. Thank you.
You need 30 minutes, so I can give you more time.
Thank you.
Or you don't need?
I need it.
Okay.
So that's it. So thank you. So, blood arterial, when you are measuring, like, let's say a person who is unconscious, you require to determine how the blood is able to get rid of the carbon dioxide and able to compensate.
Let me advise you, my friend, just tell us the test. Say number 1, creatinine. Number 2, blood urea. Don't tell us many stories.
Yeah, creatinine.
Tests. This goes to university. You are ready? Good. Answer the question. There you are asked. Elaborate on the success of analyzing electrolytes using ion selective electrodes. And I repeat, the success of analyzing electrolytes using ion selective electrodes technique. That seconds. Five seconds.
Okay, good afternoon. Ion selective electrode. First, you have to know that it is very selective and it is also sensitive.
Thank you.
Sensitivity.
That's enough. It's our sense. Kenyatta University. Kenyatta University, here is your question. Differentiate between an endpoint assay and kinetic assay. In fact, to make it better, UV kinetic assay. Endpoint reaction assay and UV kinetic assay. Differentiate between the two. Ten seconds.
So the difference between kinetic reaction and endpoint reaction is that in endpoint reaction, we measure the end product of a reaction. Like in a reaction, we measure the end product. And in kinetic energy, we measure the energy difference in the reaction. Like we measure at intervals. We measure at the energy difference at different intervals in the reaction.
Thank you for trying. Good. Now this is Technical University of Kenya. Describe the different types of in fact, don't describe, mention the different types of troponins. Mentioning. Five seconds. One second.
T1.
Hebu sema tena.
T1.
TY.
Troponin 1. Troponin.
T1.
Yeah.
Okay. Muranga. Muranga University, kindly give us the characteristics of low density lipoprotein cholesterol. Five seconds. Three seconds. One.
Good afternoon.
Afternoon.
So, low density lipoprotein first. It's also called a bad cholesterol, and it's the one that causes blockage of the arteries, like it is deposited in the arteries. Yes. Thank you.
Thank you. Then this one goes to Guinea. Kenyatta University. Now listen carefully. It's a statement. While collecting blood specimens for blood gases and acid-base balance analysis, what is the most critical step that you must observe as a laboratory scientist? I repeat, Tena, while collecting or drawing, you can use whichever word, blood specimens for blood gases and acid-base balance analysis, what is the most critical step that you must observe? Seven seconds. Five. Three.
Good afternoon. So the most sensitive stage for collection is criteria of picking the right vacutainer, and you should pick the green top for heparinized blood to analyze the blood gas. Thank you.
Let me give you another chance, please. Go back there. Consult for 5. I'll give you another. You see, we are talking about blood gases and acid-base balance. Is that clear? What must you observe when you are correcting that specimen? Very important. Let us give them another chance. Okay, 1 second.
The blood should be collected from an artery.
Next is let's pick yours. Just a minute, we get yours. Good. Listen carefully. Technofirst of Kenya. Here is, can you tell us what you understand the difference between open and closed automated clinical chemistry autoanalyzer? I repeat, tell the difference between open and closed automated clinical chemistry analyzers. Five seconds. Two seconds. Good.
So, when you are talking about open, the laboratory facility and laboratory attendant.
Hold on. So let me assist you. Listen carefully.
Yeah.
Kindly tell us the difference between open and closed system automated analyzers in clinical chemistry. We are talking about equipment.
In open, you are not restricted from getting the equipment from any manufacturer. Then closed, we are talking about reagents. In open, you use reagents. You are not restricted from using reagents from any company. Then about closed, there is restriction. Basically, open, no restriction, closed, restriction. Thank you.
Thank you. Where are we? The last one? Kindly leave the stage.
Thank you.
So, I think now I'll take over for the next panel. So we have JKUAT, MKU, KC, and KEMU. Tafadhali, chap chap. Hi. Introduction, chap chap.
Good afternoon, Mount Kenya University, clinical chemistry.
Thank you.
Good afternoon, Jomo Kenyatta University, clinical chemistry.
Thank you.
Good afternoon.
Afternoon.
Kisii University, clinical chemistry.
Thank you.
Hello guys.
Hello.
This is Kemu, clinical chemistry.
Thank you.
Start.
So we are starting with Kenya Methodists. Okay. Okay. Hirsutism in women can be associated with. What can we associate hirsutism with?
Can I kindly ask you to spell that word?
It is hirsutism. If you don't know it, you don't know it. Hirsutism.
You have 5 seconds. Okay, 4 seconds. Three seconds.
The answer is abnormal lipid profile.
Thank you. Our next question goes to Kisii University. List any 2 gender-specific cancer markers and 2 non-gender specific cancer markers. 2 specific gender cancer markers and 2 non-specific gender. 5 seconds.
Good afternoon.
Afternoon.
For the gender specific, we have PPSA for prostate cancer. We have beta HCG for ovarian cancer. And then for the gender non-specific, we have CEA, and then we have CA125. Thank you.
Thank you. So our next question goes to the next question goes to Jomo Kenyatta University. And the prof, give me a question. What do you understand? What do you understand by the term normal renal glucose threshold? What do you understand by the term normal renal glucose threshold? Five seconds. Four seconds. Three seconds. 3 seconds for Jomo Kenyatta.
Okay. The normal glucose threshold is that level at which the glucose will be completely reabsorbed back into the system. Because if it is abnormal, it will be appear in the urine.
Are you done? Thank you. The next question goes to Mount Kenya University. What is the role of the exotropic? What is the role of the exotropic polymer gel in blood specimen collection?
Okay, the answer for that is that the exotropic polymer gel is the gel that is usually found in the test tubes, and the purpose of that is used to separate between clot and it is used to separate between plasma and the cells, and also the clot and serum.
So our next round, we start with KC University. KEMU. Categories. You give me the categories of clients on loading of glucose while doing OGTT. Give me the categories of clients for glucose loading while doing OGTT. Five seconds for KEMU. 5 seconds for KEMU.
Answer is low risk, intermediate, and high risk clients.
Okay, thank you. The next question goes to Kisii University. Okay, for Kisii University, the following tumor markers are analyzed on the investigation of cancer. CA125, CA199, CA153. What does CA stand for? Five seconds.
The answer is carcinoantigenic.
Sorry?
Carcinoantigenic.
Yes. Thank you. Our next question goes to the Jomo Kenyatta University. Describe the major role of urine preservation in collection of 24-hour urine sample for creatinine clearance. You give us the role or the major role of urine preservation in collection of 24-hour urine sample for creatinine clearance. Five seconds.
Number one, it prevents the change in chemical composition. It prevents oxidation. The preservatives also prevent the conversion of creatinine to creatine.
Thank you. Are you done? Oh, you're already back. Mount Kenya University. Mount Kenya University, your second question. Describe the factors that may affect the reference ranges. You describe the factors that may affect the reference ranges. 2 seconds.
We have gender, we have diet, we have geographical location. Yeah.
And also age.
So now we go to our final questions. We have Kemu. You name for us the different blood gases disorders. You name the different blood gases disorders. Two seconds. 2 seconds. 3 seconds.
Hypovolemia and hypervolemia.
Sorry?
Hypovolemia and hypervolemia.
Okay. Our next question goes to Kisii University. Yes, sir. Give us 5 different types of fluids that we can analyze in a clinical chemistry lab. 5 different types of fluids that we can analyze in a clinical chemistry lab. I've been told that one requires only 1 second.
We have acetic fluid, pleural fluid, urine, blood.
5.
And also CSF.
Okay. So our next question goes to Jomo Kenyatta University. Jomo Kenyatta University. Okay. List 3 pre-analytical errors experienced and analytical errors experienced in a clinical chemistry lab. Pre-analytical, analytical, and post-analytical. Pre-analytical and post-analytical errors.
Excuse, you need 3 each or 1?
Can give me 2 in each.
2. Oh, 2 each.
Yes.
Oh, fine. And pre-analytical, number 1, you can error is incorrect labeling of the tubes. Another one is wrong patient or wrong specimen, wrong patient, yeah. Wrong patient. Instead of another patient, you get another patient. Those are under pre-analytical errors. Under analytical errors, failure to carry out QCs, run out QC control. Another analytical error is use of use of wrong samples. If you go ahead and use the wrong samples, that one is under the analytical error. And then the post-analytical errors, that's one where we have the delay in dispatch of the result to the patient. We have another post-analytical error is the transposition of the result, where you interchange the result of the patient. You can as well have the wrong key or wrong interpretation under the post-analytical errors.
Thank you. Your time is up. This, for Mount Kenya University, you describe how you would collect urine sample for creatinine clearance. Urine specimen collection for creatinine clearance. 2 seconds. 2 seconds for you.
Okay, first, the urine sample for creatinine clearance is 24 hours urine. So the patient is, you give the patient the container containing the preservative, and you make sure you give the instruction to the patient. You inform him or her about the preservative, and because the preservative can be dangerous when in contact with the patient body. Then from there, the patient is to put the urine for 24 hours. Then after putting for 24 hours, then he brings to the laboratory for analysis. Yeah.
So are you done? Okay. So I think we have come to a close of our clinical chemistry session. So I'd ask you to come back. So the next one is blood transfusion. So chap, blood transfusion. BT. Okay, 24 hours.
Confidence.
So we have, introduce yourself.
Kenyatta University, blood transfusion.
Kenyatta University, blood transfusion.
Murang'a University, blood transfusion.
Murang'a University, blood transfusion.
Technical University of Kenya, blood transfusion.
Thank you. Technical University of Kenya, BT.
Introduce your, you already introduced your team, so we begin with Murang'a. Question 1, BTS. State the application for direct Coombs test. You have 5 seconds. Answer the question.
We have hemolytic disease of the newborn, autoimmune hemolytic anemia, and in vivo sensitization of the cells.
Thank you, Murang'a. Next is Tuk, your first question on BTS. Can you decline blood transfusion based on religious beliefs? Explain your response. Tuk, can you decline blood transfusion based on religious beliefs? Explain your response. You have 5 seconds.
No, you cannot decline based on religious because we have specific criteria for donor deferral.
We are not getting, I didn't get.
I'm saying we have specific criteria based for donor deferral, so there are some that align with the religious, and we can, yes, we can.
All right, thank you. Yes, thank you, Tuk. KU, what do you understand by hemovigilance system? Hemovigilance system.
Good afternoon. Hemovigilance is a set of criteria that I'll set that govern the blood from the time of collection, processing to the time that the blood is released to be issued to the patient. Thank you.
Thank you. Muranga, second question. Discuss major cross-match procedure.
Major cross-match, it is done to check the compatibility of the blood between the donor and the recipient. The procedure is you label the 4 test tubes. One, saline at room temperature, saline at 37 degrees Celsius, albumin at 37 degrees Celsius, and Coombs at 37 degrees Celsius. You take the patient, that is, first you prepare 5% cell suspension by washing 3 times and discarding the saline completely. Secondly, you take a drop of blood from, you take the blood, 1 drop of blood to each the test tubes. You also take the blood of the donor from to each of the test tube. You also take 1 drop of the patient serum to each test tube. Then you incubate. That is, you add albumin in the test tube labeled. See that is albumin at 37 degrees, and you incubate. For the tube labeled saline at room temperature, you do not incubate. You do an immediate spin and check for agglutination. After incubation of 30 minutes, you take the tube with the tube labeled albumin at 37 and saline at 37. You wash the cell 3 times. You centrifuge and you observe for agglutination for both macroscopic and macroscopical. Next, you take the tube labeled Coombs at 37 degrees Celsius. You wash the cell 3 times with normal saline. After that, you take, you add the anti-human globulin. You centrifuge. After that, you check for agglutination, both microscopic and macroscopical. If there is agglutination, it is incompatible. If there is no agglutination, it is compatible.
Okay. We move to Tuk. Your next question is, explain how to prepare 5% cell suspension, and just be brief.
Good afternoon. So you take your cells, your red blood cells, you put them in a test tube, then you add...
Closer to the mic.
You then add normal saline to 3/4 of this test tube, then you put it in the centrifuge at high, you put it in the centrifuge, then you centrifuge it for 3 minutes at 4,500 RPM. Then you pour the spanatant
Then you add the normal saline to 3/4 of the test tube again. Then you centrifuge it. Then you do the same again. Then you pour the spanatant again. Then you add 3/4 you add normal saline to 3/4 of the test tube. Then you pour it again. Then you add the normal saline, 3/4 of the test tube. Then you can now mix with the cells that are at the bottom of the tube to gain your 5% cell suspension. Thank you.
KU, Tratan. AB blood has both anti-A and anti-B. Yes or no?
Answer, no.
Thank you. Muranga. Outline the 4-tube major cross-match technique. These are repetition. What is the difference between fresh frozen plasma and frozen plasma?
Pardon, please.
What is the difference between fresh frozen plasma and frozen plasma? Two seconds. Can we move to the next group?
Fresh frozen plasma, it has the platelets and the frozen plasma. That is, the fresh frozen plasma has no platelets and the frozen plasma has the platelets.
Okay. We'll move to Tuk. Duffy negative individuals are not affected by certain species of malaria parasites. That is, yes? They are not infected by certain species of malaria parasites. Explain why. Duffy negative individuals are not infected by certain species of malaria. Explain the reason as to why they are not affected.
You have 5 seconds. Two seconds. We move to the next group. Okay.
Afternoon. So they lack the rhesus factor, so the oxidizing equivalents reduce the, wait a minute. So
assist him.
No, I can do it. So they lack the rhesus system, so the reducing equivalents produce more oxidants. So working out the malaria parasite or the Plasmodium species. Thank you.
Thank you, Truk. KU, your final BTS question. Explain the reason for performing serum grouping.
Five seconds.
Serum grouping is used to confirm forward grouping, which is
Thank you. You can have your seats behind. Can you have the next group on stage? Introduce your groups.
Good afternoon.
Yes.
Mount Kenya University BTS group.
Next.
Good afternoon, Kisii University BTS.
Next.
Good afternoon, Kenya Methodist University Blood
Next.
Transfusion Group.
Thank you.
Good afternoon, JKUAT BTS.
Thank you. Easy. We begin with MKU. Your first question. Name two red cell products which can be prepared from whole blood. You have 5 seconds.
so two components of packed red cells products that can prepare from whole blood is saline washed packed red blood cells and leukoreduced packed red blood cells.
Thank you. Kisii. Oh, thank you, MKU. Kisii, your question. Outline laboratory investigations on a suspected hemolytic transfusion reaction. Be brief, you have 5 seconds.
Good afternoon. So once a hemolytic transfusion reaction is suspected, the nurse who's transfusing the blood stops immediately, and then the blood which is remaining in the pint is brought back to the lab together with a blood sample and a urine sample. So for the blood sample, we do a repeated blood group and a repeated cross-match. That is EDTA top blood. For the urine sample, we do bilirubin levels and urobilinogen. So we collected two blood in 2 tubes, one EDTA and the other one plain tube. So for the plain tube, we do serum bilirubin levels. So if it's actually a true hemolytic transfusion reaction, the bilirubin levels will be elevated and in both urine and the serum. Yeah, that's all.
Thank you, Kisii University. Kemu? When giving plasma products to a recipient, which blood group is referred to as universal recipient?
AB positive.
Thank you. JKUAT? JKUAT, discuss the investigations done for hemolytic disease of the newborn. You have 5 seconds.
So the investigations done for HDN, we have ABO and rhesus grouping, ABO and rhesus typing, direct home test, indirect home test, antibody identification, antibody screening. We have antibody titration, reticulocytosis, and you can also check on the packed cell volume. Thank you.
We go to MKU. Explain how to validate negative results in indirect Coombs test. How to validate the negative results in indirect Coombs test, ICT in short.
Okay, so after ICT is negative, the first thing that you can do is to recheck the methodology to check if everything you have done is correct. You can also check the test, redo the test. Maybe during the test you forgot something, you can redo it. Also, you can use quality control. So that is negative quality control of ICT. And then you can use the clinical impressions. That is, you go over the history of the patient to see if this person, according to the symptoms, is eligible for indirect Coombs test.
Okay, thank you. We move to Kisi. Your second question. Can you briefly explain who is a Bombay individual? Who is a Bombay individual?
Good afternoon. A Bombay blood group individual is an individual who lacks the H antigen.
Thank you, KC University. Kemu? What is the reason for washing the red blood cells? Two seconds.
The reason for washing cells is to expose more antigenic site and to wash off any surface antigen that might neutralize or inhibit the next or the preceding test.
Thank you. JKUAT? Explain how to prepare doubling solutions, doubling dilutions during antibody titration. Doubling dilutions, double dilutions.
Kindly rephrase your question.
How do you prepare serial dilutions during antibody titration?
Thank you so much. One, when we are doing serial dilution, we label the 10 tubes, whereby the tube from tube 2 to tube 10, we add 2 drops of normal saline. Then from tube 1 to 2, we add then the human serum. Then to the all from tube 1, then we now begin to do serial dilution from taking 2 drops from tube 2 to tube 3 to tube 4, and we proceed with the dilution. After then, we add the human cells to all test tubes, beginning from test tube 1 to test tube 2 to test tube 10. The reason why we are adding the human cells, we will add the human cells according to the antibody that is being titrated. Thereafter, from there, we incubate at room temperature for about 1 to 2 hours. Then, the tube whereby there's agglutination, then that is the tighter volume that we have been looking for. Thank you so much.
Thank you, JKUAT. There's a lot of noise coming from behind, please. MKU, your final BTS question. Describe the 3 phases involved in agglutination. The question is, describe the phases involved in agglutination.
So the phases involved in agglutination, there are 2. The first phase is sensitization, where specific antibodies to the antigen binds to the antigenic site of the antigen and then of the RBCs. And then the second phase is agglutination, the actual agglutination, where the second phase is the actual agglutination, whereby there is cross-linking of these antibodies and the antigens causing clumping.
Thank you. Thank you. Kisi, your final question. Which antibodies are detected by each phase of the major cross-match technique?
So, in the major cross-match, we have 4 phases. In the first phase, which is saline, room temperature, we get the cold antibodies, which are the IgM in their complete antibodies. For the saline, 37 degrees, we get the warm antibodies, the IgG, in their complete. For the albumin phase, we get the warm antibodies, which are the IgG incomplete. For the AHG, we have the warm antibodies, which are the IgG incomplete antibodies.
Next is chemo. Outline the standard operating procedure for reverse blood grouping. Reverse blood grouping in short. And be brief, be brief. Two seconds.
Standard operating procedures for serum blood grouping is that it will not be carried out to infants who are less than 6 months, since the natural antibodies will not have been developed by that time. Another standard operating procedures for serum blood grouping is that
Kindly, the other students, I believe others are not talking, eh? So take it. Continue.
standard operating procedures for serum blood grouping. It will not be carried out to infants who are less than 6 months. Another one is that in the serum blood grouping,
did you get the question in the first place? We are talking about the procedure.
Yes.
Outline the standard operating procedure for reverse blood grouping.
Reverse blood grouping. Okay, give us some minutes.
Now, that is all. Your time is over. Yes?
I want to answer.
5 seconds, 5 seconds.
Standard operating procedures for serum blood grouping, you get 3 test tubes, then you label them as A, B, and H. Then you get unknown A cells, B cells, and O cells. After you add, you develop 4% cell suspension of A cells, B cells, and O cells. Then you add 1 drop of those prepared cells in the respective test tubes. Then you add diluted antiserums, anti-1, anti-1, anti-A, anti-B, and anti-O.
Okay, thank you. I think your 5 seconds are over.
JKUAT, your last question. This has been repeated. Outline the procedure for direct Coombs test, DCT. If it is a pass, you tell us. Procedure for direct Coombs test.
For the
direct Coombs test. This is where we use the patient blood. We make 4% cell suspension. That involves you take 19 drops of normal saline and 1 drop of the patient blood. Then you add AHG. After you add AHG, you do a light spin of 1000 RPM for 1 minute, then you observe for agglutination.
Yes, excuse to add on something a little bit. My colleague here have said that we use 4% cell suspension, then we add the anti-human globulin. After then, we make a light spin. I think from your lectures, your competent lecturers told you that light spin is 1000 RPM for 1 minute. Therefore, after then, you check for agglutination microscopically and macro. Unaangalia na macho, then you go back to the microscope. Thank you so much.
Sure, my friend.
Okay, thank you. We are almost done. Almost. So parasitologists in the house. Chap. First group was TUK, Murang'a, and KU. Hata ukikuja na soda yako pale ni sawa. Okay? We want to make it very fast. Our guests, they're very hungry. Unaona mnakuja soda na hata mwezi wapatia. Mpatie wageni wangu soda. President, and you're here. Jameni. Okay. So introduction.
Good afternoon.
Afternoon.
Okay, this is Murang'a Parasitology team.
Thank you.
Good afternoon, KU Parasitology team.
Thank you.
Good afternoon.
Good afternoon.
TUK Parasitology Group.
TUK Parasit Group. So we can start.
We start with the MUT. Gynecophoric canal is a ventral groove in the female cystosome. Is it true or false? One second. Two seconds.
It's true.
Kenyatta University. Non-nuclear DNA present in addition to nucleus in protozoan parasite is more of a MCQ. So non-nuclear DNA present in addition to nucleus in protozoan parasite is A, chromatid body, B, karyosome, C, kinetoplast, D, basal body. I'm giving you 5 seconds. One second.
Basal body.
TUK.
For TUK, the first question, it's also a multiple choice question. protozoa belong to kingdom A, Monera, B, Protista, C, Plantae, and D, Animalia.
Protozoans belong to kingdom Protista.
Second set of questions go back to Moranga. Xenodiagnosis is useful in A. Wuchereria bancrofti, B. Trypanosoma cruzi, C. Trichinella spiralis, D. All the above. 5 seconds.
Trypanosoma cruzi.
Thank you. KU, name one vector of chikungunya virus, or the vector that transmits chikungunya virus. 5 seconds.
Female Anopheles mosquito.
We go to Tuk. It's a true or false question. Ticks are endoparasite. True or false? 2 seconds actually.
False.
Say the answer is true or false?
False.
Okay. Last set of questions, round 3 to Moranga University. Your question is, a definitive host is A, in which sexual multiplication takes place and harbors adult form. B, in which asexual multiplication takes place and harbors a larval form. In which asexual multiplication takes place and harbors adult form. Among those one, which is the correct definition for definitive hosts?
Okay, it's the stage in which the sexual reproduction takes place and harbors the adult forms.
KU? Describe stool concentration or stool concentration technique.
One is sedimentation technique, where you use a solution of lower specific gravity, where the organism will sediment. The procedure is you weigh 5 grams of stool, then you add 200 ml of water, then you filter using a cloth, then you take the sediment, then you place it in a slide, Then you add methylene blue to methylene blue will act as will show the background. Then you look at the microscope for eggs, cystodes.
Shallow. So we have also the another zinc sulfate flotation technique.
We didn't ask for flotation technique. The question was clear on concentration. We go to Took. Pediculus humanus is a bedbug species. Yes or no? 1 second. One second.
Yes.
Thank you. So go back to your seats. Thank you for your time. The next panel should be joining us very quickly so that we're able to finish. And as you come, introduce your groups. Do the introduction.
Parasitology group, KMO.
Good afternoon. Parasitology, MKU.
Good afternoon. Parasitology group, JKUAT.
Good afternoon. Parasitology, KISS University.
Kindly do the introduction again. We start from this group.
Good afternoon. This is MKU Parasitology.
Good afternoon. This is Parasitology group, JKUAT.
Parasitology, KISS University.
Parasitology, KMO.
Start with the MKU. Describe the quality control in a parasitology lab. Two seconds.
Okay, quality control.
Silence.
This one ensures there are no errors during performance of various techniques, and it involves use of the right samples, the right volumes of samples and reagents, and then using the right reagents doing the techniques. And then when doing the various techniques involve usage of control. Use the positive. You make sure you use the positive and control, a positive and negative control, and.
He wants to speak. Let him.
Okay, let me add on that. Quality control
It basically involves calibration of equipments. In a parasitological lab, we have microscopes. You ensure that it is working. We have use of, calibration and maintenance of that equipment. There is keeping records. Keeping records ensures that there is proper record keeping of the maintenance of those equipments in a parasitological lab. Then we have we have validation of.
You should know that your time is already up, eh?
We have, let me finish on that. We have validation of the reports, the results that get out of that parasitological lab. Thank you.
All right.
For JKUAT, the first question, entomology is the study of Entamoeba histolytica, true or false?
False.
Kisi, an MCQ question. River blindness is the name given to disease caused by A. Loa loa, B. Onchocerca volvulus, C. Toxoplasma gondii, D. Encathamiba calbasoni. Given 1 second.
The answer is Onchocerca volvulus.
For KEMU, the question is, the terminal spine is a feature seen in the upper of which parasite, or of which Hematobium species? I can repeat the question. The terminal spine is a feature seen in the upper of which Hematobium species? I think this is a... Sorry, I think this question is... yeah, you can answer.
Mansoni.
MKU. Second question. Describe how to carry out an entero test. Describe how to carry out an entero test.
An entero test is a diagnostic test used to test for duodenal giardia lamblia. It is a technique used to detect for duodenal aspirate. The kit used is a nylon capsule with a string which is attached to the end of the patient's mouth. Then after it is ingested, the string is released from the side of the patient's mouth, after which it is waited to be excreted in stool. After excretion, the string is then pressed using the string and tested for bile juice.
Thank you.
Thank you. JKUAT. Sat flies are vectors of which parasitic disease?
Sad flies are vectors of which parasitic disease? Two seconds. One second.
It causes leishmaniasis and trypanosomiasis.
Next group is KISI. A multiple choice question. Smallest nematode known to cause infection in man is A. Trichinella spiralis, B. Strongyloides stachylaris, C. Ankylostoma duodenale, D. Trichuris trichura. 1 second. One second, or your time is almost up.
Trichurious.
Kemu. MCQ. Motility of Trichomonas vaginalis is described as A. Amoeboid, B. Jerky, C. Falling leaf, D. Lashing. 1 second. One second.
Jerking motility.
Mount Kenya University, describe the Buffy-Coat technique for the detection of microfilariae. Describe the Buffy-Coat technique for the detection of microfilariae. Take the shortest time possible, please. Five seconds.
You start by withdrawing blood in an EDTA, anticoagulated vacutainer. You then spin the blood to obtain serum and to obtain plasma, Buffy-Coat and the packed red cells. You then aspirate a few drops of the Buffy-Coat, then examine under a microscope for presence of microfilariae.
Thank you.
This question is for JKUAT, the third question. Name the filarium which affects the eyes.
Lower.
Describe to Kissy, mention 5 different types of hosts. Five seconds. You're just naming, please.
Definitive host, reservoir, intermediate. Yes.
That's all? Kemu, the last one. Multiple choice. In humans, malarial parasites multiply by A, binary fission, B, budding, C, gametogony, C, schizogony. You need only 2 seconds to answer that. You want me to repeat the question? I was audible enough.
Schizogony.
You can leave the stage and thank you for presenting.
Stan, where are you? Become the photographer. So I think we are almost coming to an end of our symposium or debate or tug of war, okay? So very soon we are going to get the winners. We are not having any losers here. All of us are winners, okay? All of us are winners. So I think at this juncture, I want, because I know people are very tired, si ndio? Kakitu ya kuchangamsha, changamke. Just stand up. We just warm up kidogo, then we invite our guests. They give us their speeches or what they have to say. Maybe kila mtu hapa anatoka na kadhao, we never know. DJ yuko bado?
DJ yuko? Tujibambe kidogo ama namna gani? Si namna hiyo? Aya, kama vile tulianza universities send two representatives wakuja tupatie styles hapa. Tutaanza na TUK. Kababa, tutaanza na TUK. As they compile, let us get ready. DJ anatupatia, nataka university representatives. You're wasting our time. KU, two people KU. Mkofiti, kila mtu amepata soda. Kila mtu amepata soda. Inakuja, kama hujapata inakuja. Tulie hapo. Namna hiyo jamani. Okay, TUK. KU Central Representative, DJ shikilia wafike. Shikilia wafike. TUK. KU Central Representative haraka. JKUAT sioni watu hapa. JKUAT teketeke. JKUAT. I want two dancers. Let us be quick. MKU. Adwa Moranga, where are you? Moranga guys, teke. Adwa Moranga. Karoheni. Awaji Kikuyu. Wacha tunaenda kwa test hapa. JKUAT Central Representative, wacha nichague. Naona ni kama hamtaki. JKUAT tumaneni ama nikuje? JKUAT auo. KU auo. MKU azikizaga. MKU azikizaga. Bwana. Very good dance. Haya, DJ mpatie basi tukianza. Kila mtu sana. Watu wa nini? Pozi DJ. MKU hatuwezi fanya hivi. Mzee anatoa hadi koti. Bwana, MKU hatuwezi fanya hivi. MKU kujeni. Nitawaita na majina. MKU. Very nice. MKU kujeni. What more numbers? 2 more jamaa. And please take care of both soda bottles. Haya, wanasema weka wilo long. Haya basi hiyo siwezi pronounce. Ilikuwa ngumu. DJ twende basi. DJ anza. Kidogo DJ. As you dance, please take care of bottles. Hizo chupa za soda, my team please help me gather them. It's very dangerous. Naanguka ovyo. Help me gather them. Haya DJ angusha basi. MKU twende. The only lecturer in an airport. DJ shika bana, nyonga hiyo. Karibu iende, lakini before iende, tulieni hapo. We want to know who is the best of the best. Saba namna gani? Watu wa mwangaza mwagikeni hapa. Watu wa nyota, watu wa mwangaza wako wapi? Watu wa kemu fikeni hapa. Kujeni mwangushe nyota huku. Watu wa kemo wakijitayarisha, watu wa meja hapa KU. Watu wa meja kujeni. Vijana wa meja. Calvis mtafai na vijana wako. Mimi nitafai na vijana wa meja. Wewe watu wa mwangaza. Leteni nyota hapa. Kwani mko wawili? Mko wengi? DJ basi nipatie hapo. Anguka bana. Haya, bado tuone gani unaona. Tulieni hapo tuangalie hii. DJ shikilia hapo. Karibu iende, si ndio? Karibu iende. Wacha tuone KU wako na nini. KU kujeni pia nyinyi. Tulieni tu hapo. Watu wa KU mko wapi? Mtafanya nitaita meja. Kisi wako wapi gaki? Mundu bwari bagaria. Kisi wako wapi? Ndio kisi wako wapi wewe? DJ shikilia. Ngoja sikia hii. Nataka watu wa Mbarambamba. Watu wa Mbarambamba wako wapi? Watu wa Mbarambamba wako wapi? Wamerudi attachment. Haya basi, watu wa Tuku wako wapi? Mnachoka? Tuku wako wapi? Hamtaki kompe? Kujeni bana, kujeni. KU mna waste time. KU you're wasting time. KU. Wako wapi KU? Wapi KU1? Wapi KU2? JKUAT wanakuja in the next few minutes. Niwatoe hawa. Haya, wapumzike. Haya, DJ angusha 15 seconds. Ngoja. Haya, sikia wewe. Watu wa mwangaza, wewe cameraman. Watu wa mwangaza. Nitawatoa hapa. Mimi nitatoa hapa. Wacheni mchezo kwa kazi. Msilete mchezo kwa kazi. DJ nataka watu wa mwangaza na watu wa... Shikilia. Watu wa mwangaza mko na 15 seconds. Watu wa MKU, si ndio? 15 seconds alafu mwagike kwenye viti, si ndio? Watu wa mwangaza wamesema wako na taa wataanza, sawa? Na DJ wapatie 15 seconds. Ndio.
I want to flex my love. I want to press. I want to carry my love. We play
Very nice. Mnaweza chukua viti, mnaweza keti. DJ upatie MKU. DJ, anza vizuri DJ, anza vizuri. You are ready? When you are ready, I'm ready. Twende basi. Chukua hiyo.
I want to flex my love. I want to press.
Shikilia hapo, mnaweza kupumzika hapo. Haya, watu wa Tuku mko sawa? Give it up for Tuku. Give it up for... Skia. Tuku, DJ. Tuku is the only university next to the central bank. Lakini ulize kama uko na pesa mfukoni. DJ angusha hiyo.
Acha niwaweke wazi.
Haya, Tuku basi twende.
Mbaki na mishangao. Uswa ya mapenzi nataka kuyaelewa.
Tena kujeni on the stage.
Nataka jibonge.
DJ shikilia hapo. DJ ngoja. Nasema kwamba JKUAT wakuje wa compete na wao. Tulia. JKUAT mko wapi? You're wasting time JKUAT. Fine nyinyi. Panda hapa juu. JKUAT nataka kuona numbers JKUAT. JKUAT nataka kuona numbers. KU mko wapi KU? KU na JKUAT acha tuone. Wani wa KU? Simama pale. Hapo sawa. KU hapa. Very nice. KU wako hapa. KU ni mmoja. Wewe sikiza hii. KU ni mmoja. DJ nitafutie ile ngoma ya meja pale KU kunanga nini? DJ nitafutie. Fikeni haraka kama atafute. KU ni mmoja. Wapi mwingine? Iteni watu bana. Mko ngapi? Mko over 50? tuba. KU1, KU2, KU3. Jipangeni kwanza. DJ nipatie JKUAT hapa. Musha hiyo. Haya DJ, haya. JKUAT atabuka kwenye utosi. Aha. Aha. Yeah. Aha.
Niliambiwa nimwache sisi. Kamote.
DJ shikilia hapo. DJ. Ngoja. Iko sawa ama haiko sawa? Iko sawa. DJ ongezea sekunde 5 basi. Twende.
It looks deceiving.
Ladies bana.
Konko. Yeah. Niliambiwa nimwache
bana.
Kamote.
Ongezeka bana, ongezeka kama unataka. Ongezeka. Pose KU amesema wako wawili. Hiyo inaweza kweli? Wakiwa wawili inaweza? Haiwezi, hisi ni mchezo. Hebu watu wa KU kujeni. Watu wa KU wakuje. Nitashika cameraman saa hizi. Wako wapi kwa kamera watu wa KU? Wako wapi? Watu wa KU wako wapi? KU wako wapi jameni? Basi patieni basi. Nije angusha KU. Wacha tuone hiyo. KU. DJ. Umeona wagedhomo nyinyi? Haya basi anguka basi. DJ twende.
Usiniharibie muda. Ile umesikia kunihusu, usiniambie tu kuhusu. I just got paid. So late. Nimereconcile na be. I'm happy. Sana kalikuwa kamenuka. Vitu zake alikuwa amepaka. Mzee nilikuwa nimeshtuka, lakini leo bibi amerelax. Amenisamehe juu ya jana. Kande alipiga kama tumelala. Sasa leo tunaenda ulevi. Sitaki kulisa.
Haya basi DJ pinya hiyo. Kampasi gani imebaki? Gani hiyo? Isili. Kisii mko wapi? Kisii mko wapi? Watu wa Mbarambamba kujeni bana. Tunataka tuone mnachezanga na matope pia. Muranga. Ada Muranga. Wanakuja. Ada Muranga. Kule mto. Karedi. Kujeni hapa bana. Kujeni Ada Muranga. Muranga kwa wapi? Muranga. Muranga kwa wapi? DJ shikilia nyonga. DJ nyonga. Hawa ni Kisii, watu wa Mbarambamba. Wanacheza na matope. Hawa ni Muranga. Ita wao. Wako wapi Muranga? Mbarambamba. Nataka kuona mkifanya ile kitu ya nini. Hawa ni wa Mbarambamba. Muranga. Nini Muranga? Haya Muranga. Haya Mbarambamba sogeni hivi. Na wao DJ nyonga hiyo DJ. Haya basi ndio hiyo. Huyu ni Muranga. Yeye ni Muranga. DJ shika kidogo. Watu wa Muranga mko sawa? Nataka kusikia sauti ya watu wa Muranga bwana. Wako wapi? Watu wa Mbarambamba mko sawa? Are you ready? Nataka neno mnachezanga pale kwa matope kidogo na suti ya white. Nimelewa mna white, ndio? DJ angusha watu wa Kisii kitu hapo. DJ angusha. Haya basi twende.
Chake.
Majuka ni kama unarusha mamikono, tingisha kichwa chungu sivunje kisogo, teremuka kakonokono, ni kionjo twende mamiondo, mamio mio 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 ndo, mamio 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 ndo, mamio mio 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 ndo, tati inadonjo ni kumoto, mamio mio 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 ndo, mamio mamio
Shikilia, inaweza haiwezi. Adamara ngamulio kwa. Nije kuna keosho. Ngoja. Hiyo ni yangu si yenu. Ni request yangu mimi na dance sio ninyi. Keosho. Nataka hiyo. Nije kuna keosho. Inakuja? Mwadhani. Nataka nini? Mogithi. Nataka mogithi. Bwana, nataka mogithi. Miodoko. Nataka miodoko. Niambie tofauti difference ya al na al. Ni al. DJ. Mimi si Mkikuyu lakini naona kidogo hivi, si ndio? Nataka kuona hiyo. Hii mchezo ya nini? DJ hebu anza tena. Nataka kuona kidogo. DJ, baki hapo. DJ, baki kwa pose. Nataka ubaki hivi. Baki venye ulikuwa. DJ, nataka ushike venye nikisema pose hiyo wote mnabaki hivyo venye uko. Hivyo. DJ unanisikia? Nikisema pose, ukipose ni hivyo. Kama ulikuwa hivi. DJ wapatie 10 seconds. Angusha tena. Very nice. Mnaweza pumzika, appreciate them. Lakini kuna moja hatujafanya. Lecturers wamewachemsha sana hapa, ndio? Imekuwa kumenyamaza for 3 hours. Nenda nashangaa kunaendelea nini? DJ, nataka unitafutie ya Wakamba kidogo. Tuko na Mkamba mkubwa around. Unitafutie kidogo tu hapo. Tunakuja hapo. Si mnaweza pumzika kidogo hapa mbele. Mkuje kula kwa macho. Hiyo. DJ. Wanasema hiyo. Wamesema hiyo. Angusha tuone. Kujeni. Kujeni nyote. Pause DJ. Niko na watu wako na kamera hapa. Nataka mrekodi. Pause DJ. Kujeni. Mnasemanga lecturers wajibambi. Leo mtashangaa.
Lecturers wakuje please.
Haya basi ndio hiyo. Haya. Pause DJ. Ngoja. Watu wa iPhone mko na simu, nataka mrekodi. Mimi hatuweki TikTok by the way. Nataka tu mrekodi watu wa iPhone. Very nice. So DJ, nataka uianzishe vizuri. Na nyinyi nataka munipatie tu. Sawa. Nikisema pause ni hapo. Kila mtu hapo. Penye utakuwa Mimi si ndio MC. Mimi ndio nawapanga. Haya, DJ anza hiyo kitu. Twende. DJ shikilia. Wewe ngoja. DJ nitafuta wewe kazi DJ. Nataka unisikize. Nikisema DJ 1 2 3 kata hapo. Kama uko hapa ukigeuka hivi hapo tu, hiyo ndio posture. Sawa sawa DJ. Angusha tena. Haya, kata ngoma. Kata ngoma. Twende. Endelea DJ. Haya basi, endelea. Appreciate our lecturers. Mnajibamba hamjibambi? Symposium imeweza iwezi? Very nice.
Na mpenzi.
Tutulie sasa, si ndio? Kumbe lecturers can dance. Haikuangi tu umekuja 10 minutes late, don't come to my class. 5 minutes late, please respect my time. Leo tuko na nyinyi, si ndio? Leo ni sisi na wao. Tutawaambia kweli baadaye, sisi hizi, si ndio? Very nice. So allow me to welcome a few people. We're going to take just little time and we'll be out of here. Sawa? I'm hoping the lecturers are compiling. You're compiling the deal of the day. Tuko sawa? Tuko fiti sasa? Very nice. Allow me to welcome one of our partners, not one of our partners, it's just a short moment for our partners. They're going to take a few minutes to tell you about themselves and what they do. And please, take notes. Sawa. Do what? Take notes. They're going to take just few minutes. We have two partners today. They'll be telling us more about what they do. I'm hoping you've seen some brochures around, some wristbands. Kama umebahatika, kama hujabahatika, bahati ya mwenzio, jamani. So I'm going to welcome the wonderful group. Sorry? Okay, Lancet, are you ready? You okay? All right. DJ kidogo pia dance ndio? Washasema si mimi. Umeona? Haya, DJ moja patie pale.
Nana follow you. Cause I'm in love with you. Money follow you. Nana follow you.
Haya basi.
Good evening. How are you guys? Mko poa? My name is Viona Mora from Pathologists, Lancet, Kenya. And I know most of you have gotten some of our goodies, key holders, wristbands. Nani hawajapata? Na mko wengi. For the lecturers, I'll visit personally niwalete. Watu wenyu walimaliza. Wengine nitawapea student reps wenyu walete. Now, I'm so humbled to be here today. Thank you to JKUAT for organizing this forum. It is an educative one. I'm really impressed. And one of the things I would want to acknowledge, I can see my lecturers here. I studied at the Technical University of Kenya. Hi. From TUK, I can see Miss Alice, I can see Dr. Linda, thank you so much. So, as I've said, my name is Viona from Pathologists, Lancet, Kenya. I am a registered medical laboratory technologist. I work at Lancet, Kenya, Upper Hill branch, and I'm also a client relations officer, more into corporate wellness. Now for today, from Lancet, I would first want to ask, how many of you have heard of Lancet before? How many know of Lancet? Yeah, I can see a number of you, that's nice. So, Lancet is a is a referral laboratory. We have a wide footprint located in different counties in Kenya, and we have over 30 counties with our laboratories, and we also are located outside Kenya, and we are in 13 countries under what we call under an umbrella called Lancet Africa, which is located in 13 countries in Africa. And our mother Lancet is in South Africa, so that is why we are Lancet from South Africa. And we offer over 4,000 tests. So test yoyote yenye unaweza pata, any laboratory test that you would want done, we do it at Lancet. Na najua wengi wenyu wamesikia DNA, sisi tunafanya DNA sana sana at Lancet. And also at Lancet, we also have a new HPV detection kit, which we call the Evelyn brush. I'm sure most of you have seen the brochures that were given. The Evelyn brush looks like this. Mnazaona? You can see this is an Evelyn blush that we use it to test for HPV as a method of screening for cervical cancer. This one is DNA PCR based. So once a female uses this, it is taken to the lab. We do PCR on it and detect different types of HPV. And I would want to ask, do all HPVs cause cervical cancer? Who can answer that? Do all HPVs cause cervical cancer? No, sindio. So for this, we screen for all types of. Thank you. So for this, we screen for all types of HPV, and we are able to grade if this HPV can lead to cervical cancer or not. So in case you have any inquiries, I'm available and I can provide more information about Lancet. Thank you and have a lovely evening. Thank you.
Appreciate her. Appreciate Lancet. Yes, you can do well and visit them and know what they do. It is going to be an addition to your career development, all right? So our next partner is the Wonderful Group. Appreciate him. Appreciate him.
Okay. Hello, good afternoon. Member? Okay, so I'm very humbly stand here, and very honored take this opportunity to join this introduction. So, my name is Bear from Wonderful. So I will not, take a long time, just short time, introduce our company. Can you show some basic information? That is our Nairobi Training Center in Kenyatta Hospital. So we will show you some picture because in future we have some program with Nairobi University also. Today, 1 week ago, Miss Gracie. So I'm very happy she invited me come here. In future, we also have a partnership with Jomo Kenyatta. In part of them, this year we will sponsor two professors go to China, and even we training 2 times for all the students for Nairobi University. So next month, I'm planning to give free training, use our machine like PCR, immunoassay, even the coagulation blood gas, free training if you want. Because why? Because you have knowledge, you have power. But when you go to hospital, you must know the machine. We can give you free training. It's always free. We have the laboratory, many, calling in future, you are all of you the hope, even the professor, the hope of future. So I think very soon you will know our brand. Even now, I think our fine care machine is the first brand in Kenya. So in future, when you're working, you will know. So just this, too small? It's no problem. If it cannot show, no problem, okay, forget. because I think I use the word already explained. I have some picture, so can show to you. If can have a show here. Ismail, it's okay, it's okay. If cannot show, it's okay. Okay, let us quick, very quick, not spend a lot of time. So we quick, yes, we change page quickly. This is our headquarters in Guangzhou. Continue, quick change, not spend. This is the award. This is also, we have the fourth research center. One in Chicago, one in Japan, 2 in China. So if you visit China, I will need you to go there, have a look. Yes, quickly. This is a book, Chinese medical. You know, our owner is a professor, also is a professor. So we create the standard of the medical laboratory of China. Yes, continue. This is global. Quick, yes. This is our research center. And we have factory. Now recently, last month, we built one factory in Uganda. It's rapid test. So this year, we want to build 2 factories in Kenya. Now we have partner, negotiate with partner. In future, if you want to work, you can send your CV to me. I can introduce you, have a good payment work. Okay? Don't worry. Continue. This is the immunoassay or machine. Continue, yes. Immunoassay, this is the fine care. Yeah, please. This is the accuracy. Yes. This is the calculation. Continue. This is the PCR. Yes, continue. Pathology, business. So the continue. We not only for human, we also have the pets. For pets, if you have interesting any people, you can contact with our team. So we will show you free training in Nairobi University. Always free. Continue. Our slogan is racing for life. Then continue, please. Please. Okay. Because I don't want to occupy a lot of time. So I just show some important thing. This is the globally. That is globally our some sociability. Like here, we go to Siaya. We have went to Siaya. Busia, Makwini, Kisumu, Manning County, above the 6 to free screen, always free. So if any friends want to contribution to your hometown, you can tell us. We provide the machine, provide a rapid test, you provide maybe students, volunteer, so we go together, have local community. That is what we want to in future, not only make money here. Yes, this is that picture, please, back to 2 picture. That is in Nairobi University, our training center, all the machines there. So this is, I think Miss Grace, if any people want to there have a look, you are professor, students, all warmly welcome. You can contact Miss Grace, we give you this opportunity. Even when we have the MOU, we can sponsor professor or student to go to China next year. Because this year, only two people that give to Nairobi University. Next year, we will increase 4. So that means I want to give 2 to Jomo Kenyatta, because all of you the best in Kenya. I promise to you. Okay. Thank you. Hope I did not take a long time. Asante.
Appreciate him. As he'll be selecting 2 from JKUAT, I hope I'll be among the number. Praise the Lord. Hallelujah. Okay, I don't want to preach. Thank you so much, Wonpo, for the good presentation. I find it very interesting, and I look forward to seeing going to your headquarters. Can you make it possible? Wonderful. All right. So at this juncture, if you could allow me to welcome a senior in our department, a senior lecturer, senior prof, Daktari, is going to address us. He has been very supportive in the making of this club. Every detail, before we even go to the Dean of Students, it is him that we consult first. I think he's going to address us on phone. All right.
Okay, am I audible?
Yes, you are.
Okay, thank you. So good afternoon, attendees of the 2nd Kenya National Medical Lab Symposium. My name is Dr. Amos Mbogwa. I'm current chair of the Department of Medical Laboratory Sciences here at JKUAT. I take this opportunity to welcome you all to our esteemed university, a beacon of excellence in training, research, innovation, and entrepreneurship for development. I want to first apologize for not being able to be present in person due to other engagements. However, our department has been well represented by various members, including Dr. Peter Karanja, Ms. Joyce Gachoki, who is really in key, Mrs. Yulia Kime, and Mr. Peterson Maindi, among others. Now, I want to commend the organizers of this event, which is both an opportunity for interactive learning and healthy competition towards strengthening competencies of the medical laboratory trainees and advancement of the profession. So, hongera sana. I also want to laud the efforts of JKUAT, led by the chairman, Radak. I wish you all success, and I know you had a truly insightful experience. I especially commend all the teams from the various universities that have chosen to participate, and may the best team win. Thank you very much. Thank you very much. God bless you all.
Appreciate him. We appreciate you so much for the support, and we thank you again for honoring to give your remarks during this day, all right? Are you inspired? Have you been inspired? So the COD is aware that JKUAT was doing something big today, all right? So allow me to proceed with the speeches. We're almost there. DJ, nitafutie wakati voi hapo kidogo. When I say that, you are aware. Nitafutie wakati voi. So our president is here. The president of the Students' Council of JKUAT is here. I would like us to appreciate him in a very special way. Do you know my club? The Habacha Habaku Haba Marima. I wish it was Chinese because I would have sold that club to our partner here. But unluckily it is not. You know my club? The Habacha Habaku Haba Marima. How many know it? If you know it, awoo. Okay, Habacha, when I say Habacha, you clap once. When I say Habaku, you clap twice. When I say Haba Marima, you clap thrice. You can Google the meaning of those words later, but they are my own formulations, okay? So Habacha, Habaku, Haba Marima. So in a count of three, I want you to give it up for the president of JKUAT, Brian Mutebu, as he comes to give us a brief address, just to show that the Students' Council again is aware that the Student Council was also hosting this event. We're also part of the Students' Council, all right? So in a count of three, I want you to give it up, all right? Are you ready? Just get ready, get ready, get ready. You can prepare your claps, you can prepare some, I can see people singing, I don't know the song. All right? So when I say 1, 2, 3, you begin to appreciate him as he comes, okay? So in a count of three, are we together? In a count of three, I want you to give it up for Brian Mutebu as he comes to address us. Give it up for Brian Mutebu. Appreciate him, appreciate him, appreciate him, appreciate him.
Thank you so much. First of all, Master Stan, hii kitu ya kusema mimi ni Mukamba nilikataa. But that is where I am from. That's part of my heritage, and I am proud of it. So, JKUAT, man, I am jealous. This is I think the third activity or the fourth one that Radak has invited me to this year. And honestly, I'm jealous in a positive way because of the impact that you're having, especially even on our student body, especially on that side of COHES. When mine today is just to give you a big up and just appreciate each and everything that you're doing. And also, yeah, it's motivating. Since you copy engineering, in engineering school, we should have such, although I'm not sure whether I'll be able to answer some mathematical questions if I'm brought here and told to answer. So I think I'll sharpen my math skills or something, but this has been really a motivator. So, and also for all the partners that have chosen to be here in JKUAT, thank you for choosing our university. I know my friends are here from KMU, MKU. I was just talking to Grace Lempa right here. Nimewambia tunanyorosha watu wake. Watu wa KMU? Mko sasa, anyway, I was talking to Grace and she said that she's sure her team cannot be beaten easily. So, and also MKU, we talked to your presidents. But JKUAT, we're the best. JKUAT, we're the best. How are VP? And I'm proud of you guys. I'm super proud of you. So, because I've been given very many invites, na mimi mwenyewe sijai kuja kwa invite, today also allow me invite each and every person in this room and also members of your school and your college to our cultural festival in JKUAT, which will be taking place in the 23rd and 24th of November. 23rd ni a Thursday, so sijui mtatafuta namna mtoroke cuts ama mfanye nini, but also come and unwind. So that is my invite to you for a cultural week. That said, I know I'm a politician also, despite being a leader. I can take an hour here and I can speak up to tomorrow. But I'd like to just close with saying, again, I am super proud of you guys and great work. Thank you so much.
Appreciate him, appreciate him. Yes, the student's body has been taken care of. Mmenyamaza mnanistua. Is the temperatures below 4 degrees Celsius? Interesting. I'm going to welcome the next, just short speech. But before I do that, our team had organized an interesting icebreaker. I'm sure you have the syringes ready, Eliza and Mwaka. Yes, it is just a short icebreaker, very short. And it's interesting, it's in application to what we do in our field. We want to see some competence put into practice. Some competence put into practice. Please hurry, please hurry, please hurry. Some competence put into practice. I'm giving you a maximum of 7 minutes, maximum. I want you to learn something here. I hope I have a few phlebotomists in the house. Ayaba. Kuna watu wameanza kutoroka huku pei. There are people who have begun to
Hello everyone. My name is Faith. I'm the Vice Chair of JKUAT. We had organized something small and I hope you like it. It's called the Balloon Challenge and it's for fun and also to see how many of you are serious with your phlebotomy and also so that we can be sure when you open a clinic kama tutaleta watoto wetu huko wadungwe sindano. Okay, so we have balloons here. So we're going to inflate the balloons and then we have needles and syringes, but we are not taking anyone's blood. So we need volunteers. One from every school, please. It's going to be fun. JKUAT, one person. KU, MKU, Muranga, come on, come on. Yay, please come. Thank you. JKUAT, Muranga, Kisi. You can do. Two schools here. It's interesting. Come on. JKUAT. Thank you. You're from? KU bana, kujeni hapa. Thank you. Okay, so our participants have inflated their balloons. Who is missing? One school is missing. Oh, okay, thank you. So spread out. Okay, so we're going to give them syringes, needles and syringes. Mi sitawafungulia, acha lecturers waone venye mnafunguanga hizi vitu. You share this. Yeah. And then, okay. So we have a demo there. Let's take some seconds to watch the demo. So you're supposed to prick it, but it should not pop. Okay, they're using gloves though. Yes, like that. So that's the challenge. So, yeah. Go. Yeah. So have you seen that contest? Have you seen it? It's embarrassing. Hey. Okay, you ready? Are you ready? Yeah, so you have seen the demo, right? You're good. So tunaenda kuona ni nani alikuwa ana harass watu pale phlebotomy. Yeah, so let's start there. Is your syringe and needle ready? Okay. Which school is that? Kisi. Okay, let's do it for the school. Tunawatolea 5 marks hapo. 5 marks lost. Okay. Next. Okay. Which school is that? Took. I mean, take your time. Look at the balloon well. I mean, have wisdom. Look at it. Ni wapi unaweza. Be wise. Okay, let's go. JKUAT. There we go. Okay, that's nice. Point for JKUAT. Thank you. Okay. Which school? Okay. We check that. MKU. Okay. Next school. Which school? Muranga. Let's go. Oh. Nice one. Take notes. If they open clinics, unajua ni wapi kwa kuenda. Ama utaenda kulia huko. Next. KU at Kujuka. Next. Well. Yes. So that was the challenge. Just an icebreaker. Thank you.
Did you enjoy the challenge? Did you learn something? Mimi nimelearn overconfidence. Unaingia kwa vein alafu unaanza kutafuta damu nyingine yenye umeshapata. You know, I was in my attachment the other day. Kwanza kwa watoto, lakini wazazi poleni. Sisi interns ndio tunapewa watoto wenu hapo na pale. Unaingia hivi kidogo, sio ni vein. Umeona kitu amedu? Alafu wacha nitoe. Unaingia tena. So as a phlebotomist, please practice your competence. Skills is important. Just be gentle. Mwana watu wenye anashika sindano the way you get it. Did you enjoy the icebreaker? Very nice. Allow me to move to the next part of the program. Allow me to move to the next part of the program. You're aware that KMLTTB is represented? You're aware? What does KMLTTB stand for in full? Ngoja. Sitauliza mtu. You know it, ndio? You know it? You are sure? You are sure? Okay, haya. Wacha tuone. You are sure? You are sure? You are sure? You're looking for the one sleeping, mwambia nimpatie. Shika. Sasa nyinyi. Ili ibu, it is gone. Sasa ndo ile pale basi someni ndo ile. My technical person utanilipa. Kuna mtu bado hajui. Basi ndio hiyo, acha tusikie. Wacha ni test hizi cards. Kuna mtu bado hajui. Ni wewe utatujibu. Appreciate her as she answers. Appreciate her. Mpatieni nguvu mpaka asimame. Appreciate her.
Kenya Medical Laboratory Technicians and Technologists Board.
Appreciate her. Very nice. So we are going to have just a short address from a representative. Not a short address, sorry. We are not yet there. I almost missed it. We are not yet there. I want to welcome the Association for Medical Officers. Then we shall finish up with the keynote. Appreciate her as she comes on board. MC glucose levels iko chini.
Good evening, everybody. Or it is not yet evening. It's going to 5. I hope you are all well. My name is Aglin Chelimo. I'm the Vice President of Association of Medical Laboratory Scientific Officers, that is ACAMSO. I don't know how many of you have heard about it. By show of hands, how many do we know about ACAMSO? I am so surprised. So today we'll learn about it, we'll know about it. So ACAMSO was registered as a professional body in 1964. How many of us were born by 1964? Handful. The rest of us, it's okay, we'll get there. Appreciate Dr. Ari, he was there. So it was founded in 1964, and it is a non-profit and non-partisan organization. It represents all medical laboratory scientific officers throughout Kenya and beyond. When I talk of beyond, we have our members who are outside this country. They may be in the UK, they may be in the US, and any other country. Our vision is ensuring excellence in medical lab practice in the Republic of Kenya and beyond. Our mission is to advance and maintain high standards of medical lab services by adhering to strict professional practice. Our approach is that ACAMSO recognizes that medical lab professionals have the responsibility to contribute to the provision of quality healthcare services in the Republic. It also initiates discussions with relevant bodies, including KMLTTB, to bring about desirable professional changes and ensures professional demands are taken into account. When I mention the KMLTTB, I am very sure you're asking yourself, we have the KMLTTB, we have CAMSO, we have the NAMLO, we have, remind me, Mwalimu, LMSK, any other? We have a number of bodies, and all of them, they represent lab. So you should know as a student, each of one of them stands for what? Yeah? So for the association, ACAMSO is the oldest, and it is the one which gave birth to the KMLTTB. It is the one which fought for a regulatory body. That is way back in 1999. And that is when the KMLTTB came into place to regulate the practice, the training. Yeah? I think that one, somebody will talk about it. But me, I will talk about the association. And then we have also, it establishes collaborative working relationship with other health care professionals and regulatory bodies, Ministry of Health, health research institutions to undertake healthcare programs and activities that benefit practitioners and the public. When I talk about this, ACAMSO is not just on its own. We work with other healthcare setups or institutions to make sure that what we are supposed to do is done it in the right way. It also contributes to the advancement of the profession by improving the profession's body of knowledge and by seeking fair socioeconomic working conditions for its members. I am very sure this is what it used to do before. But at the moment, we have areas where the association has to work on. For example, you want to be employed outside this country, you will have to go to your professional association body so that they can give you a recommendation later. You want to represent the members in the board. The association has to give you a letter of introduction to say that they know you and you are their member so that you can be allowed. When you are to be employed even in other organizations, even in the, like for example, you want to work in the board or you want to do some service in the board, it is the association who will give you the recommendation letter so that you can be accepted and you can be allowed to work there. So when I talk about the association, we also have membership. I will only dwell on two types of memberships, although we have almost like 5. We have temporary, we have ordinary, we have cooperative or corporate, we have honorary, founder and absentee membership. So today I will only talk about the temporary membership, which belongs to the students. Why do we call it a temporary membership? Because you will not be a student for the rest of your life. You will be a student like for 3 years, 2 years, 4 years. But after that, you will exit to go to the next level, which is now you are working. So you will have now your ordinary membership. So for students, it is open to all students pursuing a course leading to qualification in medical lab science from institutions which have been approved by the KMLTTB. So for you to be registered as a temporary member, you have to be in a college. You are not just in somewhere where it is not recognized. It has to be somewhere like JKUAT. So when you come there, we'll register you as our student, but it is temporary. So for temporary members, you pay entrance fee of 100, you pay the membership of 500, and then subscription per month is only 250. Hello? Don't get worried. Just listen. Where I'm going to is very important. Yes? So when we have the ordinary membership, this one is open to all qualified and registered officers. And they must have the qualifications in the medical lab science discipline to one of the following levels. So for the association, we accept everybody. Whether you have trained with a certificate, with a diploma, with a degree, with a PhD, or even you are a professor, we accept all of them, as long as it is in line with the medical laboratory line. So for those who are qualified, I will also mention their fee. It is entrance is 100, membership 500, and subscription 500 per month. In short, I will just say just the benefits of being a member. One is education. For you to have your CPD points, you need to go for seminars. And when you go for a seminar, you go for a conference, and usually conferences are organized by the association yearly, and we also have so many people who have been attending, and you get some CPD points so that you can renew your license. The other one, I just want to be very short. Welfare. It also negotiates for terms of service for members and conditions of service and allowances for its members, and protects the professional interest. For example, there are some allowances which our members have been paid through the agitation of the association. Sometimes back, we used to have, if I talk about sometimes back, we used to have just the association, and it used to make sure that when you get a problem, maybe with your employer, you are underpaid, maybe you are being they are not fair to you, then you come to the association and then they take up the matter. But I'm very sure now, and I'm so happy that we have the NAMLO. I am sure that is part of their work. Thank you, and I know they are in the house. Then annual scientific conference, we also organize that. And during the scientific conference, we have the students forum. I don't know how many of you were in Diani, Mombasa, last month. How many of you? Two people were there, and also your lecturers were there. And we had a very successful students forum where their issues are discussed and handled appropriately. Then we also have, yes, 1 minute, I'll be through. Then we also have experience of seeing or listening to papers, oral or poster presentations. And also another advantage or benefit is a publication of those papers which have been presented. They are published and people can be able to come and see them and even read them. Then on the last one is where we support the branches. We give 25% of what they have contributed so that they can start some activities in the branch. So with that remark, I think the time is very short. I want to thank you, and I want to encourage the students to register as members while you are still students. And when you exit, you also continue to be members of the association. And I would urge the lecturers to assist the students. I remember around 38 to 39 years ago, I was assisted to register as a member of the association, and I'm still a member until now. Thank you, and may God bless you.
Appreciate her. Then second last of our speeches, I'm going to give just 2 minutes. 2 minutes. I think my timer is okay over there. 2 minutes to LMSK representative, who is going to just tell us a little bit about LMSK. 2 minutes strictly. We are very much behind time.
Good afternoon, members. Thank you very much. My name is Frederick Ade. I'm the National Organizing Secretary for LMSK. LMSK is Laboratory Medicine Society of Kenya. I want to say that to the organizers of this symposium, thank you very much. We look forward to more engagements. We look forward to more forums of this nature, because honestly, as I sat there, I learned a lot. And I would say that to the students, these are opportunities that mentor you in a very special way. Because the next time, today you are standing before your lecturers, tomorrow you will stand before a panel. And it will give you the exposure, the soft skills that you need for the outside market. I will not go so much into LMSK because we have been into JKUAT before. We have introduced what MLSK does. These are just professional bodies that, we foster excellence for the profession, and also we want to improve the self-regulation for medical lab sciences. I want to say that don't be worried between Akamulso and LMSK. Don't be worried. We have 17,000 officers in Kenya, above 17,000 officers. That is according to the board. Out of this, we are told that around 14,000 are active. We don't know where the others are. But out of the 14,000, you can get that the membership in Akamulso is around 2,000. So we ask ourselves, where are the others? So we are saying, let no member be left behind. Join an association, because at the end of the day, we are improving medical lab sciences. I'm happy for such a forum because MLS has grown. MLS has grown tremendously. This week, from Tuesday until Thursday, I was in Nakuru, where we were in a forum that brought in the DG, the two PSS, that is the PS for medical services and the PS for public health. We had the division for, laboratory services, and we also had the National Public Health Lab. We had Akamulso, we had Akamla, we had LMSK. There are wonderful things in this profession. It is rare for us to come together and talk things that concern this profession. So I want to say that I'm very glad when we can come together. I've seen even some of the manufacturers here. I want to say that LMSK is distinct for the graduates. There's a reason. There's a gap that we identified, and we felt that maybe we can come in and strengthen the other associations so that we can move together. I want to cite two things. The manufacturer said something about taking our students, abroad. Right now, bioinstrumentation is taught as a single unit. And in the near future, the lab is 80% automated. In the near future, we are going into the era of artificial intelligence. We are going to the era of precision medicine. We are going to the era of 3D imaging. The lab will be over 90% imaging. So what I'm saying is that let us come together. Let us strengthen the profession. Let us ensure that lab is where it needs to be. Finally, I want to say that to all the graduates, those who are graduating maybe this year or sometime next year, we are also concerned about the issue of employment. Because for a very long time, we have the counties and we have the national government, and we also have the non-governmental organizations. What I'm saying is that the counties are not recognizing, or they are not recognizing or employing graduates at the right job group. That is the job group K. And what we are advocating is that we are calling upon all stakeholders to join hands so that, you know, when our graduates come out there, this is very important for them, because it's one thing to train, it's another thing to practice. Let them be employed at the right job group and with the right benefits because they have studied. So what we are saying is that we wrote letters to the Public Service Commission, we wrote letters to the 47 county public service boards, and we have seen the benefits. So far, 10 medical laboratory officers, that is the graduates, have been employed by the county government of Trans Nzoia. So far, 4 graduates have been employed by the county government of Meru. So far, 10 graduates have been employed by the county government of Bomet. Can we clap for ourselves? So on this issue of employment, I know time is much spent, but what I'm saying, this is very important for our graduates. Right now, our graduates are even being sorted in abroad. That is international practice. So what we are saying is that we are not only training for the local market. Personally, I'm ACPI certified. I sat for American Society for Clinical Pathology exams. And right now, when you do that, there are other organizations out there that are taking our graduates and they are going to work in USA and Canada and things like that. So what we are saying, we have become the global favorite. This is Kenya. When you go to Ghana, when you go to Nigeria, you know, in the continent, they are running here to look for graduates. So when you get outside here, don't be frustrated. You are in the right hands. All the global market is coming here to look for us. So just work hard in class. Just ensure that you know that you do the right thing, and we shall meet outside there, because you are our future colleagues. God bless you, brothers and sisters.
Appreciate him, appreciate him. I hope you've gathered a point or two, all right? Is that okay? Is that true? Have you gathered a point or two? Finally in our speeches today, I have the honor of introducing our keynote speaker, the one that is going to give us the address for the day. I'm hoping you're ready with your notebooks. Are you ready with your notebooks for the students? Or your brains are very much alert? Just a minute. Was making consultations to make sure that everybody got soda. The chairs just confirmed it has worked all over. Is that true? Kuna mtu hajapata refreshments? Okay, so finally, I'm welcoming Dr. Kenneth Muna. Appreciate him as he comes on stage. Appreciate him as he comes on stage. Appreciate him, appreciate him. You can do better than that. Some energy for him, some energy. Thank you.
Good evening. Yes, I know we've had a long day. We are tired. Glucose level, at least it has been boosted. Thank you, Jace. And before I speak, I'd like to have two people in front of, to come in front. That is Dr. Linda Allen and Dr. Stanley Waithaka. Mumeona hawa? Mnawajua? Okay, so Dr. Waithaka will just say a word last because I and Dr. Linda Allen are alumni of JKUAT. Linda Allen was in the first group, the first BSc MLS group. I was in the second BMLS cohort. And Dr. Waithaka, najua amefundisha wengi. Yes? Na sisi pia ni watoto wake. So acha asalimie watoto wake na atupatie baraka.
Hiyo ni ya ukweli. Haki yao. Mule ambaye nishasimama mbele yake na kufundisha sana ongea na Kiswahili leo. Sitaki kuongea na Kiingereza. Sasa nataka kusema mtu yote nishafundisha nako kwa hii kogomano asimame. Mtu yote anajua nimesimama mbele yake. Munaona hiyo? Na sijigabi. Hata sijigabi. Sasa kwa vile I know, I thank you. Okay, you can sit. They are very obedient students because they are also studying when I'm. Anyway, I don't want to use a lot of time. And as Dr. Muna has said, I've been teaching this profession since 1992. That's when I started teaching. I'm not telling you when I started working. Sidio? And I'm very happy to be in this institution because the first time I came here was in the year, was it 2001? 2001. And I can also see my friend here. In fact, I don't know why we forget him. Dr. Karanja. Yeah, he's also one of us. Otherwise, ladies and gentlemen, let me take just 1 minute. In those days, when I joined the university, I had a dream. The dream is what I can see today. I used to say, one day, one time, we'll have such a competition. And in fact, if you are the students, the readers who are there before the ones in Mount Kenya, Regan. One day Regan came to my office and then I told him, why don't you have some activity where you are going to involve all the universities? What I had in mind, because when I looked at Regan, I said, now, why don't you start with a dancing competition for the universities? You know, that was I had in mind. Then I said, now, why don't you look for the one that we are having today? So to me, as I sit there, I'm a very proud man, very proud, because what I thought many years back, it has actually happened. Ladies and gentlemen, I wish I had started this in the morning because right now, even me, I don't have the energy. Hata ile soda nimekunywa imeisha. Kwa hivyo sitaki kumweka sana. Mine is to wish you well. And for the ones who are almost doing the exams, kindly make sure that you pass. Kindly pass. Ya ukweli, mpite. Hatutaki kuona watu wakianguka. Sawa? Na hiyo machache, Mwenyezi Mungu ambariki.
Good evening. It's going to good night now. I'm Linda Allen. My area of specialty is in immunology. I am also the academic team leader for the biomedical department in TUK. I want to say that this function here, this event here today is, I thought it would benefit the students, but I feel like I have benefited more. Like it is a refresher. In fact, I should pay you all for the answers you gave here. Whether they were wrong, whether they were right, we were learning. Most of us seated here as the judges were learning. When a clinical chemistry question was asked, and I'm an immunologist and I'm clueless, I learned. Yes, let's be honest, okay? So, the stuff that you are doing as students is very motivating. I was in JKUAT as an undergraduate student, and I never thought of even putting my head around organizing such an event. we were, you know, undergraduate, you're all playful, you are just, and you feel like you've been forced to study. So I find your caliber of students very motivating and continue with the same spirit. I'm happy that we are really generating. You are going to be highly professional, lab, medical. You're going to observe the professionalism that is required because you give your area of specialty, which is medical lab science, the seriousness that it deserves. This is an area that deals with the human health, and what you are portraying here is a real motivation. So continue in the same spirit, and you will go far. I hope to get involved even more. I remember when our representative from CHUK told me about this, I felt ambushed. So, and in Technical University of Kenya, we are really technical. Like for you to get, even students to get to this function, you have to go through a lot of processes to have them approved to come to this function. So I'm happy to have been able to push, and they are here today and they participated. And that gives me the motivation to even engage further. For all the stakeholders that organize this event, I'd say keep it up. This is a good thing going. Thank you all. God bless.
Thank you, Dr. Linda Allen and Dr. Stanley Waithaka, among others. So I remember, I think it was 23 years ago, I had sat somewhere there for a unit of UCU. I think it was 101, communication skills. Listening to the lecturer. And now I'm the one who is, yes, by then we didn't know, actually it was the first degree course. It was not even acknowledged or being recognized at that time. I remember for us to get even attachment, you are given letters with all the names of everyone. You move from one office to another. I remember Professor Mwachiro is the one who really advocated for that. And thereafter, since for the love of the university, I came back and did my master's in immunology. And thereafter, I decided to further, and I did my PhD in immunology. After that, I became a lecturer, and with time, with research, with supervision, I'm now a senior lecturer. And with time, supervision, research, God willing, next year, November, I'll be an associate professor. Simunipigie makofi. So that is the short journey that I've highlighted in the aspect that there are so many different ways in which you can earn a living as a medical lab practitioner or a scientist. We've seen the 1-4, we've seen the Lancets. All those are medical lab professionals, yes? So they've ventured into that particular field. Somebody like me, I saw that it was best that I venture in the field of giving back to the community in terms of lecturing, and that is where I am. There are others who are in the practice, others have moved to different areas. So let me encourage you all that this is the profession that a pharmacist will depend on. A clinical medicine or clinician will depend on your profession. The doctor will depend on you. The nurse or a nurse will depend on you. Yes? So where does that place our profession? Where does that place our profession? Up there. Yes? And it is the only profession that we don't practice witchcraft. Yes? Unaumwa na kichwa? Yes, I usually give this example to my students. Yes? Unaumwa na kichwa ama a child or your daughter, your infant has high fever. You decide to go the other way of treatment. They ask you for, is it a chicken? A white chicken or a black chicken? Yes. And then when you take the chicken there and your child, you are told, place your child there, remove all the clothes. And that particular person will hold the chicken by the legs. Yes? And start singing as he does like this on top of the child or the infant. What do you think the chicken will do? It will flap the wings, sindio? And then the child is there. So is there any difference from that with a fan or a fan enye inaleta baridi? Na ukienda umewacha kuku saizi ni 1,000 ngapi for those who are going for dates? Kienyeji. Yes? So, but our profession, for us to know what the problem is, we do the diagnostics and you give results. Sindio? And then from there, the treatment, it will determine your treatment or the care that you will be given thereafter. So I'm always proud to be happy. I'm always proud to say or excel as a lab scientist, a lab profession, a medical lab officer, and I will shine wherever I go. Yes? Unajua ile netango kujiamini, so tunaweza jiamini sisi wote. Yeah? So with those few remarks, I'm here to represent my chairman, Dr. Titus Mutwiri, the chairman of Kenya Medical Laboratory Technicians and Technologists Board, whom the invitation was extended to him from the association, the student association, and due to other engagement, he requested that I may represent him in this function of the forum. And I think I'm equally able and I have learned a lot. And in the board, I'm one of the directors appointed by the former CS Health. And I chair the education committee. We are also in that committee, Dr. Waithaka Stanley is also a member of that committee. So he sent me his speech, which I will just read as it is. And that's why I decided to make my remarks first before I read the speech. Sio ni sawa? Very well. So, ladies and gentlemen, our distinguished guests, faculty, our future leaders of medical laboratory sciences. It is with great honor I stand before you today to first thank the JKUAT Laboratory Student Association for inviting Kenya Medical Laboratory Technicians and Technologists Board, who is the regulator of your profession, to be with you today. This event is not just a mere congregation of minds, it is a celebration of knowledge, innovation, and the indomitable spirit that drives the field of medical lab science forward. I extend my deepest appreciation to all of you, but above all to the students gathered here today as participants, presenters of various, we've seen, units in this particular symposium. Your choice to pursue the science-based program, and particularly MLS or medical lab science, is commendable. Your presence at this symposium reflects your commitments to advancing healthcare, and for that I applaud you. The profession of medical lab practice in Kenya is regulated by the MLTT Act, that is MLTT Act of number 10 of 1999. This legislative framework underscores the critical role of professionals, the professionals play in formulating, developing, and implementing medical laboratory policies. Very soon, after you leave university, you shall join other professionals who are already implementing these functions for advancing the profession. Seeing you through the lens of my inner eyes fill me with pride, and it is my prayer that the determination will keep growing and getting more deeply rooted into the calling of this noble profession, without which medicine would have been either guesswork or worse. And here in quotes, this is what we say, witchcraft. That is why I feel the organizers of this groundbreaking symposium have done a commendable act of kindness to the soul of our profession's future. Bringing together students from various universities and colleges demonstrates the safe and secure future of our profession. Your dedication to fostering collaboration and knowledge exchange by bringing together students from other universities and colleges is vital for the advancement of discipline in MLS. In moments like this, we showcase the breadth of lab medicine to seniors and peers. As you engage in this discussion, you've shared your feedback, and you have participated in this symposium. Remember, the knowledge exchange here today has the power to shape the future of healthcare. Your collective efforts inspire both your peers and seniors alike. The scope of medical lab function is expansive. It covers areas of infection control, diagnostics, various aspects of public, medical, and also environmental health. Currently, we talk about One Health, where we incorporate every aspect. I encourage each of you to remain committed to the cause of laboratory medicine. The challenges you face are opportunities for growth and innovation. In the pursuit of disease diagnosis and research, you play a pivotal role. Let the connections made today foster collaboration, foster innovation, and a collective commitment to advancing the frontiers of medical laboratory sciences. My advice to you is that you may seek out for a mentor among your senior colleagues and let them walk with you towards your stability in the profession. As we look around, we see the faces of the future and bright and inquisitive minds who have chosen the noble path of medical laboratory sciences. To the students here today, I commend you for embarking on a journey that goes beyond textbooks and classrooms. You are the torchbearers of a profession that plays a pivotal role in healthcare, silently contributing to diagnose, treatment plans, and the overall well-being of patients. The theme of this symposium, which was fostering proficiency and professionalism in medical lab, in laboratory science, encapsulates the essence of our gathering. It is a call to action, a reminder that the future of medical lab science rests in the hands of those who are willing to explore new horizons, challenge existing paradigms, and push the boundaries of scientific knowledge. In our pursuit of excellence, let us first acknowledge the remarkable progress made in the field. The contributions of the medical lab professionals have been pivotal in the advancement of the healthcare, from early disease detection to monitoring treatment efficacy. But, my friends, there is still so much more to achieve. The rapid evolution of technology presents us with unprecedented opportunities. Molecular diagnostics, artificial intelligence, and data analytics are reshaping the landscape of medical laboratory science. Embracing these innovations is not just an option, it is a necessity. Our ability to integrate cutting-edge technology into our practices will define the quality of healthcare in the years to come. To the students present today, I implore you to be the architects of this change. Your fresh perspectives, enthusiasm, and adaptability are invaluable assets. Embrace the challenges that come with the evolving nature of our field, for it is through challenges that we grow, innovate, and redefine the limits what's possible. So in conclusion, my fellow colleagues, faculty, and aspiring medical lab scientists, let us leave this symposium with a renewed sense of purpose. The future is not a distant reality, it is an unfolding right before us. Together, let us empower ourselves, our profession, and our communities with the knowledge and innovation that will shape the future of medical laboratory sciences in Kenya and beyond. Thank you, and may this symposium be a beacon of inspiration for the incredible journey that lies ahead. Thank you. So, the president ako wapi nimpatie hii speech? Yes. So this is from our chairman, and I'll just give it as it is. Thank you. Good. So I think I don't have anything else to add, and I think I'm happy about what I am. I'm a mentor also, as I was mentored well. MKU, the students who are here, they might not know me, but I'm the one who started that course you're doing in MKU. That was way back in 2006. Yeah? I started that program there, and after it was up and well, we moved to the next level, which was masters. Is there anyone who did masters? No. Masters and then PhD. We launched it. So once that was done, I knew my work was completed well. And I decided to move to Murang'a University of Technology, where I also did the program, and already I've graduated the first lot. So the next step is master's, PhD. After that, then we decide where we are. So it's about mentoring. Yeah? It's about mentoring. So I usually say, you are seated in that seat. The moment you get out of that seat, is there anybody else who can sit on that seat and perform what you are performing? So that is mentorship. And we need to mentor each other. Sawa sawa. Let us love ourselves. They usually say that this profession, I don't know how true it is. Chelimo, I don't know how true it is. Ati tunakuanga ni kama tumefanya nini? Kama tumerogu. We don't like ourselves. So as students, continue with that love of yourself, your neighbor, and your profession. Yes? Our professional associations, they are aware of this and they all know this, but we are working together. We are working together. And I'm also happy to know that Chelimo, you're still very strong. She was my student, an undergraduate student. Na ndio huyo hapo. Sawa sawa. So with those few remarks, I wish to stop there. Thank you.
Appreciate Daktari. I'm sure you've gotten so much today. Is that true? Especially on the bit of mentorship. On the bit of mentorship is very, very important. And just ask your neighbor, do you have a career mentor? Just ask your neighbor, do you have a career mentor? Who do you look up to in careers? Do you have a career mentor? Do you have a career mentor? Just talk to your neighbor, or you're your own self-mentor. Ayo ni uongo. Ayo ni uongo. Ask your neighbor, students, ask your neighbor, do you have a career mentor? Tell your neighbor, if he or she doesn't have, please find one. They might be one of those sitting at the front benches. Wako hapa, ndio? So you're here. You can just mentor one until akuwe daktari. Akuwe daktari, I'm a prof. Thank you so much, Dr. Muna. My students just sent me to ask a question. Daktari. My students sent me to ask a question. They've been revising for the board exams. When are the exams? Nimesikia December, January, they're just worried. When are the board exams happening? They've sent me to ask that question as the MC and as part of their fraternity. Kasema standard tutete. So I think he's going to answer that.
Thank you. The board exams are usually scheduled twice. That is in November and in the May series. So if it doesn't take place in November, it usually takes early July. And if not in May, maybe late June.
Is that clear? Is it? So you've gotten that clarity. I think we are now okay with the speeches. Are you ready with the big horse in the house? I can see stomachs beginning to contract. I can see Jamani, sawa. Let me reduce the tension. Okay? Let me reduce the tension. Allow me just 2 minutes to reduce the tension. 2 minutes, okay? 2 minutes. Madam is very ready. I can see she's up and down. 2 minutes. Your stomachs are cutting, but allow me to reduce the tension. Your index finger up. Your index finger up. Index finger up. Everyone, index finger up. Index finger up. Right hand, right hand, right hand. Do you have a neighbor on the right? Do you have a neighbor on the right? Ask them to put their palm on top of your finger. Very nice, interesting, very nice. Don't do anything. Ask your neighbor to put their left hand on top of your right finger. Very nice. I think now you're okay. So we can drop the fingers down. When I say one, wherever I'm going to mention one, just put your finger up. When I mention two, place the palm of your finger of your hand on that finger. And when I say three, do the thing. Do you know the thing? Grab it. And grab it in such a manner that the neighbor cannot hide. He cannot hide that you grabbed the finger, okay? 2 minutes, just 2 minutes, reduce the tension. So one day, everyone, one day, I was walking and I met two friends. There's somebody who is not doing the icebreaker. You're making us repeat. One day, there was a symposium at JKUAT that had two amazing guests, just two amazing guests, with one head, with one car. Instructions are clear. With one car. Kuna mtu ashaanza kushika. That had two. Bana wewe. That had two legs with four. Kuampole. Then as I was going round, I met one friend of ours who was a daktari. Okay. This friend of ours had two lecturer friends that were part of his mentors. And he gave two sodas to one. To one. I can see the moment. You can't wait for three. Ndio. Ona nyi wote amko. For two. Very nice. Two countries that are bordering Kenya have two countries that are bordering Kenya. Do you know the two countries bordering Kenya? They have three lakes. Finally. Ameshikwa na kuna kuficha. Oi. Tell the neighbor you grabbed. Oi. I'm sorry, next time they are speaking. Lastly, let us do it for the last time. Okay, sawa. Mmesema zi. Tension ipungue. So let us appreciate Madam as she comes. Amesema anakuja kutuambia tu mazuri, si mambo mengi. Mambo ni matatu. So winners ni watatu.
So good evening again. I know we are very, very tired. We have our friends from Meru, kwa Mwangaza, and imagine they have to go all the way. So I'll make it very, very brief. So I will call upon their leader, Mr. Ambua, to read for us the winners. We said we're all winners, okay? So first we'll celebrate all of us. Kila mtu ajipigie makofi. At least I know that I have mentored somebody that will talk over my seat once I'm gone. Okay? So I've mentored all of you. So at least when I'm gone, you'll be seated where I am. So before he reads for us, I just have one point I need to point out. At least we have noted that in a few subjects or in a few thematic areas, we need to pull up our socks, okay? We need to improve. For example, in hematology, okay? I am not saying that we failed, but we need to do what? Pull up our. You can imagine in the next few months, you'll be working in the hospital, okay? So whatever that you have felt challenged, challenge yourself, go back to books. If you need any clarification, all these people are here because of you. Another area that we also need to pull up our socks. No. Clinical chemistry. Clinical chemistry. And clinical chemistry is normally here. For me, it's here. Okay? So I feel very bad when it is one of the subjects that we need to pull up our socks. So kindly, Stephen, go ahead.
Good evening. Pleasure to be with you this time. It has been a good day. KMUAT is our first time to attend this event, and we have enjoyed, we have interacted, and we know what we have been missing. We'll make sure future events will be there. Let me also acknowledge Dr. Waithaka. This man has challenged us, and that is why we are trying to reach where he is. And when I joined MSc here in JKUAT, we met in the corridors, and he grabbed me and he told me, can you come and join my clinical chemistry class? I told him, my friend, my mind has already been fixed towards hematology and transfusion, but we are together, we are one in the same thing. Without wasting much time, let me just read out the results. There is no winner, there is no loser. We are just encouraging each other. So maybe if I tell you you are in position 1, just celebrate, but not permanently, because tomorrow it will be grabbed by someone else. So let me start with, I'll start from bottom up. So we converted the marks out of 500. We just did some conversion, and we have our brothers from KU. They are in that position. As we move, took next. So they scored, KU scored 196. This is just something to, maybe we need to, it is a good grade. Nowadays we are just talking about competency. Competence, it doesn't matter the score, but provided you can do what we have been trained to do. They scored 204. Then the Mangazas, we have 309. We have 309. Then we have Moranga University, 344. 344. Kisii University. By the way, congratulate Kisii. Just imagine these guys, they just appeared from nowhere. In fact, they are the people who have shook the ground. So they scored 360. Then my number 2, brothers from my main mentor there, that is MKU, 448. Then, you see, for me, I'm not celebrating because here I am presented by 3 universities. I'm KMU alumni, JKUAT alumni, and you can see my bottom. I'm currently there. KU. I'm a student there, doing my PhD. So me, I can't celebrate much because I belong to all of you. So JKUAT, they scored 459. Now I can just hand over to my colleague for more. Yes? She will take care of the units. Or the scores.
So what I am thinking, I will make sure. You saw you are a panel of, was it 7, eh? 7 of us, 2 per session, eh? So I will share the per unit to your lecturers, if you allow me. Okay, you want me to read? Please, just allow me.
Because of time.
Because of time, okay? We have the raw data, so I will share with your lecturers. You go and discuss, okay? So I know 459 and 448. Okay, you want me to read for you? Okay.
Just read.
Kisii University, Hematology they had 25, KU 18.5, JKUAT they had 20, MKU they had 30, MUT 7, TUK 8.5, KMU 23.5. Microbiology, 15 for Kisii, 15 for KU, 30 for JKUAT, 30 for MKU, 30 for MUT, 10 for TUK, 25 for KMU. Histopathology Saito, 18 for Kisii, KU 15, JKUAT 30, MKU 15, MUT 21, TUK 20, KMU 20. For parasitology, 26 for Kisii, 0 for KU, 25 for JKUAT, 30 for MKU, 20 for MUT, 20 for TUK, and 30 for KMU. BTS, 29.5 for Kisii, 19.5 for KU, 29 for JKUAT, 30 for MKU, 20 for MKU, 8.5 for TUK, and 12 for KMU. Clinical chemistry, 15 for Kisii, 2 for KU, 30 for JKUAT, 25 for MKU, 25 for MUT, 6 for TUK, and 0 for KMU. Okay? So are you happy now? Okay. Hello. One thing I know, we cannot all be happy. We cannot all get 100%, okay? It is okay. They want a supplement. You want a remark? So the next thing is now I want to call upon Peterson, come and present for us some presents that we have here. These presents have been given by our able, wonderful team. A clap for them. So this is how we are going to do it. I will call upon the chairs for JKUAT, MKU, and Kisii. JKUAT, MKU, and Kisii. JKUAT, MKU, and Kisii. Hey. What? Mary. Waidaka, Daktari, call for me, Mary. They are saying that hematology, they feel that they scored 30. You know, when we do an exam, we all think, we come out saying that I know I have 100. Sindio? But it depends. I can tell you for sure, I was not marking BT, hematology. I only marked clinical chemistry and I think histology. So we had a representation in each and every section. So let's just accept the results, okay? So we have Kisii. Thank you very much. Okay? JKUAT? So this is how we are going to give out. We have a few things. So we let the chair will go and decide together with the lecturer on how they are going to share this. Okay? So we'll give our first, the KC University will give them 2 diaries. Give them 2 diaries and 7 pens. We have some pens. Karanja, Dr. Karanja, come and present the gifts. Mary? Dr. Linda? So let's clap for them as they receive their gifts. So you pick the ones that they have dropped. Thank you very much, Kisi. Kisi, you can just step aside, up or to kando. Then we have MKU. They'll get 3 and 7 pens. So we're just trying. So next time I hope we'll have a bigger things to offer. Sorry? There's no next time. There's always a next time. So Jake, JKUAT, they will get 4 notebooks and 7 pens.
Love the way you dance, girl. I am why I love fire, mommy. Let's hop in my Maserati, baby, hop in my Maserati. I said hop in my Maserati, hop in my Maserati. Girl, I wanna see you go down. Yeah, say me I love the way you bend body. Hop in my Maserati, baby, hop in my Maserati, and I just wanna see you. Somebody needs somebody.
I think you can see even how fair we are in giving a present, eh? Unataka number? Okay. So, Jake, what is that? Then we have another present for the kissy lady. She's tuned out. We can all agree. Oh, yes. This lady from nowhere, they came. They deserve that. Sindio? Sakarai? Then I will also call all the other universities, 1 representative from TUK, from KU, from MUT, and from KMU. Yes, the other 4. Kindly come. KU, TUK, KMU, and MUT. Give them 7 pens each. We have something also for them. Thank you. That is Muranga. Thank you for coming. Then we have thank you. Then we have Tuk, yes.
So tight, coming close. It's been a hell of a ride, but every single moment you were there by my side. I never am broken. Give
KU, thank you. So again, we cannot leave this place kindly. I'm just finishing. We can't leave this place without appreciating two very important people. We have Dr. Idaka, kindly move forward. Dr. Muna, kindly come.
It's magic anytime that's what you get. I make I just love you and hold you for my hand. 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 Over and over again. Yeah, my love is burning day. Feels like time is frozen and night is forever.
They are saying that they have to be given by ladies. You dear, come.
Yeah, feelings I've been holding.
Big Amzuri, Big Amzuri.
You make me feel whole. Whenever I'm lonely, you're there for my soul. Wherever you are, girl, that's where I call my own. Whenever you doubt it, I'll be letting you know. Oh, I want to be dancing forever.
And then now finally I'll give the other judges. Mary, come forward. Dr. Linda. Wow.
Just love you and hold you for my
Linda, just come.
Hold you for my hold you for my
Delibo.
Hold you for my hold you for my hold you for my hold you for my I wanna be in your light until the night is over. I wanna hold you so tight, coming closer. I wanna be in your light.
Come on.
You got that sweet vodka, your love is sweeter. So below juice mixed with a little ginger. Oh girl, I wanna be with you, but you know they got enough time for me. I wanna live with you. I get the reason why I can't.
I think now we come to the end of our symposium. So I'll call upon you, dear, to give vote of thanks as we hand over to the students. I hear there is more organized for you during the night. I don't know for how long. So for us, you will allow us to leave after this. Thank you.
Oh girl, I wanna be with you, but you know they got enough time.
Good evening, everyone. Good evening, everyone. Naona tumekasirika. There's always another time. Yeah, so I like to take this chance and give the vote of thanks. First and foremost, I like to appreciate the organizers of this event. We can kindly appreciate JKUAT. Yeah, for their tireless efforts in ensuring that this event was a success. I would also like to appreciate our partners, OneFor, Lancet, and also our keynote speakers for honoring our invite and also being patient with us. It's now 6, but they've been here since morning. We really want to appreciate. I'd also like to appreciate all the universities in attendance. KU, TUK, Muranga, KEMU, MKU, and Kisii University. To the judges,
I also want to appreciate you for the wonderful work you've done. You prepared the questions, you came in early, you've moderated well, and thank you so much. And to the winners, congratulations. Congratulations, but know that you've seen how KMKU, they're not happy with you. So next year is going to be tough. JKUAT. So, and for everyone who attended this event, I'd like to appreciate you. Yeah, may God bless you for your sacrifice. And we hope to have such an event coming next year. I think our leadership are going to inform us of the venue and other details. So see you around next year, and God bless you. Thank you. Radak San.
All right. MKU, oh, okay, let me not touch anything. But for footballers, you understand, once away is won and home is won, who are the victors? You know that, ndio? Oh, sawa, nimewacha. Oh, hawaelewi? Oh, niachane na wao? Okay, sawa. Thank you so much for bracing this occasion. You guys honored our invitation and we really honor you a lot. Allow me to represent JKUAT, sir, all right? Apart from me being a photographer, an MC, a speaker, I'm also a student here in JKUAT. You know, very many people forget that. They think I'm just an outsider, yes. My lecturers will tell you that I'm very competent.
So just before we leave, somebody whispered to me something. So Murang'a University, where are you? Murang'a University, where are you? We are coming. Your lecturer, Dr. Muna, has just confirmed that the next symposium will be in Murang'a University. Okay? Sorry? Noted. Yeah, just come. Ameguzwa, he wants to tell us something.
Good evening. Good evening. So I am once again Alvin from Murang'a University. Let me first, I'll be brief. So I want first to welcome all of you to our association launch that will be this month. I'll send the official letters probably 25th of this month. Secondly, our able COD, Dr. Kennedy Muna, has confirmed that we are having the next symposium. Sindio? I want to congratulate the winners of today's event. Makofi tafadhali. Alafu, tumekuwa number 4. This is our first event, so we are very happy, at least. KU, inakaa Meja hakukosea, ama namna gani? Yeah, sure. Thank you.
So thank you Murang'a University for accepting to host us. So we'll come, all of us.
Okay, photographer, our photographer is okay? Before our lecturer gets to leave, allow me just for 1 minute to advertise myself. So mwana nimepiga kazi fiti? Nimepiga kazi fiti au la, ndio au la? Yes, you can get me as I'm a corporate moderator. I do corporate moderation and I do a little bit of emceeing. If you had fun, please. Yes, it's only that I didn't carry my business card today. Maybe my PA next time is going to bring it on board. Yeah, so all right, but you can get my phone number. Niwache? Nipeane ama niwache? Nipeane? Huenda nikapata Okay, my number is 0715. In case you have any events, any kind of corporate requiring moderation, yes. All right. Even as our lecturers come, let me give my details. Just come to the front. Our photographer is getting ready so that we get. Yes, our professors, our lecturers, our judges, our mentors. Yes, I was saying my number is 0715 23 8785. 8785.
Thank you so much. That is Stanley Museti. In this association, he is the Secretary General. So I'm going to take over from here so that I can facilitate how we are going to take the group pictures, the group photos. But before that, I would really like in a special way to recognize my executive, and I would like you guys to come forward and introduce yourselves briefly. Kateti, kuja. Kateti, Mbetsa, where's Mbetsa? Just allow me. They did a magnitude of a job, and just say your name and go back, please.
I am Kateti K. Eric. I'm the Public Relations Officer, JKUAT Club.
That is the Public Relations Officer. Mbetsa and Liz, I think they are not around, but I would like also to recognize the Chairman of Microbiology Association, who managed to come here and congregate with us. Also would like to recognize the Chairman of Orphans Association, Zablon Ojijo. I would like also to recognize the founder of this association,